when you can, most of us. Okay, good evening. We are opening our meeting this evening in public session, and then we will convene into our private session. So I'm calling our meeting to order slightly behind today at 5:33. In attendance, we do have everyone in attendance, although we do have 4 trustees on the phone this evening. We are waiting on Trustee Leclerc, although he will be joining us shortly. Trustee Burgess is on the phone, Trustee Olmsted is on the phone, and Trustee Hatfield is on the phone, and the rest of us are here in the boardroom. So I'm looking for a mover and a seconder on approval of the agenda. Trustee Sartori, Trustee Cook, thank you very much. Any discussion on the public meeting agenda this evening? Any discussion?
Sorry, I do.
On the public agenda?
Correct.
Okay, go ahead.
I wasn't sure if we received the wording for the motion for L1 from regarding the audited financial statements. There should be a printed motion note. L1. Oh, you know what? You might have a handout that I don't.
I think we had something emailed to us on was it Friday? From Shelley Armstrong, would have been emailed to us.
Okay, with the actual wording for the motion?
There was an email sent yesterday after the audit committee that included the memo with the motion on it.
Okay, I'll look again. Sorry about that. Thanks.
No, I appreciate that. So we'll make sure that we read that out when we get to that agenda item as well. Thank you for pointing that out. I will pull that up and make sure that we have that when we get to that agenda item.
Oh, I appreciate that. Thanks.
Of course. Anything else on the public meeting agenda? So we don't have any amendments. Everyone in support of the public meeting agenda tonight?
Support.
Thank you, everyone on the phone as well, and that passes. Mover and a seconder to convene into private session. Trustee Cook, Trustee Sartori, any discussion? Anyone opposed? And we are now in private session. Thanks, everyone. Late this evening. We did have some things run over in our private session, so I thank you very much for your patience. I will call this portion of our public session to order. I'll go through the attendance again. We do have 4 trustees on the phone this evening. Trustee Olmsted, Trustee Hatfield, Trustee Leclerc, and Trustee Burgess are all on the phone. The rest of us are here in the boardroom. Trustee Cheen will be just right back. I'm going to start with our land acknowledgement. We acknowledge that we are on land and surrounded by water, originally inhabited by Indigenous peoples who have traveled this area since time immemorial. This territory is within the lands honored by the Wampum Treaties, agreements between the Anishinaabe, Haudenosaunee, and Lenni Lenape and allied nations to peacefully share and care for the resources around the Great Lakes. Specifically, we would like to acknowledge the presence of the Three Fires Confederacy, the Ojibwe, the Odawa, the Potawatomi, and Huron-Wendat peoples. We are dedicated to honoring Indigenous history and culture while remaining committed to moving forward respectfully with all First Nations, Inuit, and Métis. For everybody's edification, we do have a list of delegates this evening, which I will read out when we get to J. And on the original publishing of the public session agenda, we did have at L1 that statements were not available at the time of agenda prep. So when we get there, I will make sure that I read that out so that everybody can follow along appropriately. For now, we are at E, declarations of conflict of interest. Does anyone have any declarations of conflict of interest for in here? Seeing and hearing none. Actions of the board meeting private session. Trustee Cook.
Thank you. The first one we have under business, G1. Can I have a mover, please? Trustee Satori. A seconder, Trustee Sipkar. Anybody opposed?
The matter of property
Madam Vice Chair?
Oh, I'm sorry, matter of property, I apologize. Anybody opposed to G1? It passes. G2, personnel. Trustee Satori, Trustee Sipcar. Anybody opposed? And that passes. Thank you.
Thank you very much.
Point of order, we had one more item in camera. That was motioned out of item C. C1, did we do that? C1, did we approve that in public session?
It's okay. Thank you, Trustee Sipcar. So we have C1, Trustee Satori. Seconder, Trustee Higgison. Anybody opposed? And that passes. Thank you.
Thank you very much for that and for that clarification. Appreciate it. Moving on to approval of the minutes of the board meeting of October 19th.
Chair Burgess, it's a point of order. I don't know what happened. I heard two motions. One was property and one was personnel. I just want to make sure that the minutes reflect what we did because I heard three votes, and I think there were still only two items. There was item G1, a matter of property, and an item G2. It was presented as G2, a matter of personnel.
There's three. She's missing the C.
We did have one at C1 as well that we passed.
C1. I don't know why I have down here G2. Okay.
But we did do G1 and G2 as well. Sorry. I just wanted to make sure they get included.
Yes, so we have G1, a matter of property, G2,
Yep.
a matter of personal information. We also, in addition, had C1, a matter of,
okay.
personnel.
Okay, thank you for clarifying that.
You're welcome.
Correct. Thank you very much.
You're welcome. Thank you for that clarification. It gets a little fuzzy in here with phone calls, so I'm glad to keep everyone on the same page. I'm looking for a mover and a seconder of the minutes of October 19th, moved by Trustee Sartori, seconded by Trustee Sipcar. Any discussion on those minutes? Seeing and hearing none. All in support of approval of those minutes of October 19th?
Support, Burgess.
Thank you, and that passes. Much appreciated. Any business arising from those minutes, trustees? Seeing and hearing none. Student trustee presentation this evening. Will it be Ms. Hawkins? Thank you. Go ahead.
Good evening, Director Kelly, Board of Trustees, and Senior Administration. On November 4th through 7th, Malik and I attended the Ontario Student Trustees Association Fall General Meeting. We were excited to participate in some meaningful professional development and network with other student trustees from across Ontario. An important idea that I enjoyed learning about was the concept of learning, disrupting, and rebuilding, with respect to student advocacy. In advocacy work, we start by learning and being open to education, disrupting outdated ideas, and rebuilding our path forward collaboratively. Malik and I have been working on planning the Student Leadership Conference with the help of a committee of Student Senate. We have a working theme of perseverance with the goal of inspiring students to come out of the pandemic stronger and ready to lead. Thank you to the students who are helping to organize this event. We are eager to meet with our fellow students in a virtual setting for some great leadership development later this year. At the November Student Senate meeting, school representatives were excited to share the activities that they have hosted at their schools. These included Spirit Weeks, Halloween activities, outreach activities with local Indigenous communities, and Remembrance Day ceremonies. Some of our student councils, clubs, and sports teams have also had in-person meetings. Thank you to our school administrators for making this possible. The Student Trustee Election Committee shared the draft Student Trustee Regulation with Student Senate, who approved of the new direction for the election of student trustees. Working on the draft regulation has been a great learning experience in collaboration, consensus building, problem solving, and critical thinking. Thank you to Director Kelly, Superintendent Gorbach, and Michelle Marcus for your continued support and guidance, and to our amazing group of leaders on Student Senate. And I'll pass it off to Malik for our first Student of the Month.
The student of the month for the November is Satora Kong, a grade 11 student at Vincent Massey Secondary School who exemplifies the theme of kindness. Satora is consistently considerate, generous, and caring towards others within the Massey community. She is quick to say a kind word, pleasant to be around, and ready to lend a helping hand. Radiating with positive energy, Satora makes friends easily and encourages others, which ultimately makes our school community a better place. Day after day, Satora sets a perfect example of how to express kindness in a variety of ways. She is known to go out of her way to cheer up her classmates or give them a compliment. She's often seen lending others her gloves when they are cold, inviting a classmate to join her and her friends, and complimenting others. Satora is a person who understands the importance of kindness and the impact it can have on others. Congratulations to Satora for being selected by Student Senate as the November Student of the Month.
That's wonderful. Congratulations. Any questions of clarification for our student trustees? It would be so wonderful to have Satori in here with us so we could congratulate her properly, but congratulations to you in any case. Thank you very much for that. So we do, trustees have a list of delegations this evening. We do, no? Speakers. They're all speakers? Yeah. Thank you. My apologies. We have no delegations this evening. They are all on the speakers list. So we are moving through J on to K. I'll get there, guys. I'll get there. We're on to speakers list. We do have Lisa Brosseau will be first, and she is speaking on L2.
Madam Chair, point of order.
Yep.
How many speakers do we have for item K? At the approval of the agenda, that wasn't shared, I don't believe.
Unknown participant is now joining.
We have 5 speakers at item K. Four speakers.
We have 4 speakers at a maximum of 5 minutes each.
That's right.
Thank you.
You're welcome. Ms. Brosseau, are you with us?
I am here.
Wonderful. So you will have 5 minutes, and then trustees will be able to ask you questions of clarification. I will start the timer whenever you're ready.
I'm ready.
Go ahead.
Okay, thank you. My name is Lisa Brosseau. I'm a retired professor from the United States. I worked at the University of Minnesota and the University of Illinois, Chicago, as a researcher and academic throughout my career. And I retired in 2018, but during the pandemic, I've been consulting with organizations on methods for protecting workers from exposure to SARS-CoV-2 virus. I'm an occupational hygienist by training. My areas of expertise include infectious aerosol exposures and respiratory protection, which I think are very relevant to today's topic. I'm here today to support the motions by Trustee Leclerc that education staff be permitted to wear respirators in the workplace and that the Ministry of Education be asked to support better masks for staff and students. Staff in particular are at enhanced risk of COVID-19 due to their age and the long time periods they spend in contact with students and coworkers. Even if they are vaccinated, their risk for infection and symptomatic COVID-19 remain elevated as the vaccine was designed only to protect against severe symptoms and hospitalization. COVID-19 is an aerosol transmissible disease, which means that it can be transmitted by inhalation of small infectious particles that can remain airborne for long periods of time. Cloth, face coverings, and surgical masks may be able to prevent the emission or inhalation of larger droplets, but their efficacy is very limited for small infectious particles. With the potential for asymptomatic people generating many small infectious particles during breathing, talking, etc., it's important to implement controls that will prevent inhalation of these particles. While schools and other settings should implement controls at the top of the hierarchy, such as vaccination, frequent testing, and ventilation, respirators also have a role to play in protecting staff and students from small infectious particles. I have written several articles posted on the University of Minnesota Center for Infectious Disease Research and Policy, CIDRAP website, that describe the differences between cloth face coverings, surgical or medical masks, and respirators. I will share the URL for those articles in my written notes. A good way to understand the difference in protection from different face pieces is to consider how much time they give someone until they've received an infectious dose. Building on the CDC 15-minute contact tracing time as the baseline for obtaining an infectious dose, it is easy to calculate the additional time offered by face covering, surgical masks, or respirators. For example, if an infected source or an uninfected person are wearing a face covering, the time to an infectious dose would be 20 minutes or 5 extra minutes past the 15. If they're wearing a typical surgical mask, the time would be 30 minutes, an extra 15 minutes. It is only with a respirator, fit tested or otherwise, that the time to an infectious dose extends into the realm of hours. I called the board's attention to the table in a recent CIDRAP article, which I will include in my written notes. Now that respirator supply chain issues have been resolved, I believe it is time to start deploying them in workplaces and the community. Thank you for giving me the opportunity to speak today. I'm glad to answer questions if there are any.
Thank you, Ms. Brousseau. Do we have any questions of clarification for trustees? Trustee Cook, go ahead.
Thank you. So my question is, are you recommending education staff wear respirators and N95 masks all day when hospital staff wear surgical masks unless they are in an area of the hospital that an N95 mask is warranted? Are you telling me that education staff need an N95 or a respirator all day?
I am, and in fact, my recommendation for healthcare workers has also been that they should be wearing respirators.
Thank you. Trustee Burgess, did I hear that you had a question?
Yes, Madam Chair. It takes a moment to unmute and mute, and so when you ask for questions, it sometimes takes that time. And anyway, yes, I do have a question for clarification.
You can go right ahead.
Through you, Madam Chair, to the speaker, I heard you say fitted or otherwise. If you could repeat that sentence and explain why your recommendation is whether it's fitted or otherwise, could you please expand on that? Could you repeat it and expand on it?
Sure. Let me find the sentence. It is only with a respirator, and in parentheses I said fit tested or otherwise, that the time to an infectious dose extends into the realm of hours. The table can be found on the University of Minnesota CIDRAP website in an article that I wrote about what can masks do, part 1. It's a commentary, and if you search on my name and CIDRAP in the University of Minnesota, you'll find that article with that table. What I meant by not fit tested and otherwise is that even a respirator that's not fit tested provides better protection, both source control as well as inward inhalation protection, than anything else in terms of a cloth mask or a surgical mask. Certainly, a fit tested respirator is a much better option. But it is because they have very good filters and they are designed to fit well, that even if they are not fit tested, they will provide better protection. Certainly, as an occupational hygienist, I would recommend fit testing for workers, but I have been recommending for the community as well as workers who are not required to wear respirators and just required to wear face coverings, that they should be wearing respirators that are not fit tested.
Supplemental, if I could?
Yes, Trustee Burgess.
And it is about the fit, so I want to just explore it just from my understanding. And I did get a prior presentation with the links, and I looked at some. Is there less likelihood of a medical mask, as suggested by the board through the province, being better fitted or less fitted than a respirator? In other words, do we always have like 100% great fit, and we're checking the fit of the medical masks that are being distributed? Is there anything in your experience, study, or whatever where there's a preponderance of one being fitted better or less well than the other?
Surgical masks and medical masks are not designed to fit. They are not expected to fit well. The purpose of them, initial purpose was for them to prevent large droplet expulsion from the person who was wearing them, a healthcare worker in surgery. They've since been expected to protect people from large droplet sprays and splashes into the face. But again, that doesn't require a lot of fit. The problem is that these are not, this exposure is not to large droplets. What I'm worried about and what we should be worried about is aerosol inhalation and emission of small aerosol particles that are infectious. That a surgical mask cannot do because it is not designed to do that. You can't fit test a surgical mask or a medical mask. I mean, you can, but you won't get any. You won't get very much fit. But I should be very clear: they're not designed to fit.
Okay, so just to put a fine point on it, a respirator can be fitted. But even if they're not fitted, a non-fitted respirator is still superior to a medical mask because they're not designed to fit.
Yes, that's right. I tell people that if they get a filtering face piece respirator, for example, an N95, you want to get one that fits, that it matches up with your face. It rests against your face. It's not too large or too small. And that you use both of the straps and that you form the nose clip. But you will get a better fit. Most people will get a better fit with a respirator under those circumstances than they would ever get with a medical mask or a surgical mask, and certainly with a face covering.
Thank you very much. Trustee LeClaire, go ahead.
Thank you, Madam Chair. Through you. If you could speak to the expected period of time that a surgical mask versus an N95 mask has a useful lifetime.
You mean in terms of people wearing one?
Yes.
A surgical mask is considered a single use. You put it on, you wear it for a while, you throw it away. It's not designed to be donned and doffed many times. A filtering face piece respirator is considered disposable, but it is not single use. They are designed to be worn several times. The research has shown that after about 10 times putting a respirator on and off, they start to lose their ability to fit well, mostly because of the loss of stretchiness or overstretching of the straps, for example. The filters will continue to work for many days and months, but it is the other components that can start to lose their integrity. So they are not considered usable for months and months, but you can certainly wear a respirator multiple times.
Thank you.
Sure.
Any other questions from trustees? No. Sorry. Seeing no other questions, thank you, Ms. Brousseau, for your speakers list presentation this evening, and you'll provide that to Madame Leboeuf as well.
Yes, I did.
Thank you very much. We appreciate you joining us this evening, and we'll just wait a second while you get off the call here before I call on the next one.
Okay, I will do that. Thank you.
Unknown participant is now exiting.
Thank you very much. The next speaker that we have is also speaking on L2 this evening, and it's Mr. Kevin Hedges. Kevin, are you with us? Kevin,
Hedges speaking.
Unknown participant is now joining.
Mr.
Hello?
Hedges, is that you?
Yeah, it's speaking. How you doing?
I'm well. How are you?
Pretty good.
That's great. So you'll have 5 minutes. I'll begin the timer when you are starting to speak, and then trustees will be allowed to ask questions of clarification following. But you can start whenever you're ready.
Okay, sure. So I've been asked to talk about why should the school board provide educational workers with adequate airborne protection, so enhanced personal protective equipment. And so I'm an occupational hygienist. I'm certified as with the Australian Institute and also the American Board of Industrial Hygienists. And, you know, I'm an occupational environmental scientist, probably another way of describing what I do. One of my specialties is prescribing protective equipment for workers. So in the field of occupational and hygiene in Canada, we have a Canadian standard, Z94.418, selection, use and care of respirators, which, you know, it's a decision process to decide the appropriateness of respiratory protection. So then applying this standard to COVID would imply a minimum recommendation of an N95 respirator as a minimum level for respiratory protection against this virus. And, you know, arguably a case could be made for a much higher level of protection, such as that used in China, including powered air purifying respirators. Thus, if the minimum protection for an airborne exposed to SARS-CoV-2 virus is an N95 respirator, preferably fit tested, embedded with a respiratory protection program. So I just think we need to make it very clear that SARS-CoV-2 is now transmitted via the airborne route, so it can be inhaled. We can breathe it in. And I did provide a paper that outlines, provides the evidence around how it's airborne. And I guess, you know, the infection protection and control community has kind of stuck to their guns and, you know, you basically implied that it's really droplet and contact exposure. But we now know that it's aerosol and airborne exposure as well. So if you think about the Delta variant now, it's really a completely different situation as well, a lot more risky. You know, shown to be, so it has a viral load with 1,000 times greater than the original. So I've tried to provide as much evidence as I can just to demonstrate airborne transmission. And just case in point there, in Germany and other European countries, they've actually mandated the use of N95 in crowded public spaces, such as retail and mass transit. And then that kind of like, just let me look at the surgical procedural mask compared to respiratory protection, a respirator. We know that a surgical mask is inadequate as a respiratory protection. It's fine against, you know, spray from a patient or, you know, working in a sterile environment where you don't want to contaminate the patient, but it's not really designed as personal protective equipment. And I provided some information to show the evidence suggests that N95s are much better than surgical masks. So, you know, a table is provided to demonstrate that N95 FFR, filtering face piece respirator, even if not fit tested, offers more benefits as both source control and personal protection than any mask. So I guess if you think about being in public, you know, you observe people with surgical masks. You'll note the gaps around the sides and the nose, and air takes the path of least resistance. So if you think about the coronavirus being airborne, it'll just follow the airway path and go through those gaps. And, you know, it's been shown that wearing a surgical mask provides as much respiratory protection as placing your hand over your mouth and nose. So think about the protection factor of a surgical mask. It's about 2. So it allows about 50% leakage in both directions. N95 is so much better, 95% protection, 10% leakage. And if you think about an N99, which are readily available, they'll provide about, they'll lead about 1% leakage, so with a fit factor of 100. So really the optimal engineering design, a single-use respirator, is an N99, and they are available in Canada. I'll talk quickly about that. So, you know, should workers who are not tested be allowed to wear N95s? And the answer is yes. You know, if fit testing cannot be formed due to a lack of resources.
Mr. Hedges, we are at, sorry to interrupt you, we are at 5 minutes.
Okay, so I'll just leave it there. The Public Health Agency of Canada has now, really reinforced that coronavirus is airborne, and they're also indicating that N95s provide better protection. And I guess also the document I provided says watch out for fake respirators. So there is a Health Canada site.
Thank you, Mr. Hedges. I appreciate that. And you'll provide some written remarks of this evening to Madame Leboeuf?
Yeah, I did actually send this document that I've been reading through to Melissa.
Thank you very much. That'll be helpful for our minutes. I appreciate that. And thank you for joining us this evening and sharing your views. We appreciate it. I'll give you a few minutes to jump off the phone here, and then we'll go on to our next speaker. Thank you.
Okay. Thanks for allowing me to share. Bye-bye.
I'm sorry. Nope, I jumped ahead. Sorry, Mr. Hedges. There may be questions from trustees. I jumped ahead. Trustee Cook, go ahead. My apologies, Mr. Hedges.
Thank you. Just a little while ago, we were told that you can wear an N95 mask 10 times. Is it not true you can wear them 3 times, maybe 4, with the proper decontamination process? Can you explain the proper decontamination process and how much the effectiveness of the mask decreases each time you wear that mask?
So what happens? The more you wear it, the more worn it gets. So it's not so much going to become contaminated because it's unlikely that that you're in a dirty environment. But the fit you probably lose the fit. And I'd probably say even though they're single use, you wear them for 1 day. I probably wouldn't go for any more than say 3 days. And a lot of the colleagues of mine, the scientists, are saying that if you have 7 of them. And you'd wear 1 each day of the week, and then you leave the others to air out, and then you go back to the first one. So I could say you could probably say 7 of them you could probably use for 3 weeks. You certainly wouldn't go and decontaminate them. I think that would be a simple way to do it. Hope that answers your question.
Supplemental.
Can you please explain the decontamination process and how intense that is with the heating and everything that needs to be done with those masks to wear them successfully and for them to be working the following day?
I wouldn't decontaminate them. By decontaminating them, that's implying is that you're adding something to them to disinfect whatever's on them. I wouldn't do that. What I would do is leave them out in the air just to air, to dry out. And then I would also probably use 1 each day for 7 days in a row, and then after the 7th day, go back to the first one. And I probably wouldn't use any more than 3. I think I said that earlier on.
Thank you, Mr. Hedges. Any other questions from trustees? Trustee Halberstadt.
Yeah, Mr. Hedges, you mentioned in your report that the masks that we're wearing tonight, and pretty well all of Canada, I think, or certainly all of Windsor, are the surgical masks are inappropriate, or they're not worthwhile. Am I putting words in your mouth, or what are you saying?
I wouldn't say they're not worthwhile. Firstly, if they sit over the top of your nose and below your chin, they're about 50% effective. So there'll be 50% leakage both inward and outward. So they're better than nothing. And if 2 people are wearing them, then you're definitely going to reduce the risk. But if you move to an N95 or even better an N99, you're going to have a much better face fit. And then you're going to be better protected, and people that that are exposed to you are going to be better protected. And if you think about children under 12 not being vaccinated, definitely significantly reduces the risk of exposure to them as well. Thank you.
Thanks. Just a supplementary. So the mask I have on tonight is inadequate, but it's better than nothing. Would that be?
I don't think I used the word inadequate.
You did. 50%.
Well, okay. 50% 50% isn't 99% or 100%. So it's better than nothing, but you can get much better. So maybe suboptimal is a better word to use than inadequate. Does that answer the question?
Yeah, thank you for clarifying.
Thank you. Any other questions of clarification for Mr. Hedges this evening before we send him off? Seeing and hearing none, I thank you, Mr. Hedges. Now you are free to go. We appreciate you coming in this evening and sharing your views with us. I'll give you just a few seconds to jump off the call.
Yeah, no problems. I put my phone number on there. And I did provide an email. If anybody has any follow-up questions, please get back to me.
Thank you, Mr. Hedges. Thank you.
Thank you. Bye-bye.
Just give a few seconds here, and then we'll go on to our next.
Unknown participant is now exiting.
So our next speaker on the list this evening is Jane MacArthur. She will be speaking on item L2.
Hello. Unknown participant is now joining.
Good evening, Ms. MacArthur. How are you?
Good. How are you?
I'm well. So you'll have 5 minutes. I'll begin the timer when you've begun speaking. It'll be after you introduce yourself. And then there'll be an opportunity for trustees to ask questions of clarification following your 5 minutes.
Wonderful. Thank you.
Perfect. Go ahead.
Okay. Good evening to everyone, and thank you for allowing me to speak. My name is Jane MacArthur. I'm a mother of 2 elementary school-age children in the board, and I'm also an environmental and occupational health researcher with a PhD, and I'm on staff with the Canadian Association of Physicians for the Environment. I have researched and advocated for airborne protections from COVID-19 since spring 2020 as a team member investigating healthcare worker pandemic protections. This research is published in a peer-reviewed journal and other publications. I've joined hundreds of scientists in open letters and advocacy to governments and public health officials to act on the evidence that the virus is airborne. I've been following the accumulation of evidence of airborne or aerosol spread and related mitigation efforts in hospitals, healthcare settings, and schools, and I've shared this evidence and suggestions with my children's teachers, principals, the school board, the health unit, and politicians. I presented to you last spring about adverse health impacts of clot-based disinfectants, and on no less than 3 occasions in that presentation, I indicated that disinfectants were not the solution for an airborne virus. To understand airborne transmission, think of being able to see your breath on a cold day, or of a person smoking in an enclosed space. Just as an enclosed space would fill with the smoke and those inside would breathe it in, the same is true of the virus that causes COVID-19. The particles are contained in the aerosols we exhale, and thus, without a mask to filter them or proper ventilation to dilute and disperse the aerosols, others are at risk of breathing them in. Last week, Dr. Theresa Tam, Canada's Medical Officer of Health, acknowledged the aerosol spread of COVID-19 and noted the need for improved ventilation and secure fitting masks. Despite the mountain of evidence that we need to clean the air with improved ventilation, filtration, and better masking, the messaging and institutional practices at the board still focus on surface cleaning with disinfectants. This is allowing the virus to spread. For our schools to be safe, adequate ventilation and filtration are necessary, and masks are high-quality filtration measure, including fitted respirator-grade masks. Having a disproportionate impact on young people in Windsor, Essex, and these harmful outcomes are unnecessary and preventable. Better masks must be part of a prevention strategy. Health units and school boards across Ontario, North America, and even globally have implemented these measures, and Ottawa School Board is a most recent example. N95 respirators, a gold standard for masks, are needed. Multiple studies assess mask efficacy and find surgical masks, the blue ones you're wearing right now, and by educators and staff in the board, filter only about 12% of aerosols. Cloth masks filter approximately 10%, and N95s are anywhere from 50% to 95% efficient, depending on the fit. And I've already shared this information with multiple decision makers on the board as a concerned parent. I was also told in those communications to speak with the health unit. And so I did that and indicated to a nurse in the Healthy Schools Department that my own children wear child-sized N95 respirators to school every day. She laughed at the suggestion that still children and staff should wear N95s, but this is an affront to the scientific evidence before us. Better masking is a simple fix. My youngest daughter is a student at DM Eagle, a kindergarten to grade 6 school where no child is old enough to be vaccinated. It's also an exhaust-only school, a woefully inadequate ventilation system at the best of times, but especially for a virus transmitted in the air. There are currently multiple COVID-19 cases at DM Eagle, and many children are now in quarantine and learning from home, with teachers teaching in school and online simultaneously. Approving better masks for staff, educators, and students is the right thing to do for the health and safety of children, educators, staff, and our community, given the exponential spread that occurs. We need a layered approach to prevention. N95 respirators for staff and students are a critical part of the layered prevention strategy. I strongly encourage you to adopt this change and compel you to apprise yourselves of the scientific evidence of airborne transmission and recognize the need not only for better masks, but also proper ventilation, filtration, and eating outside. CO2 monitoring in all learning spaces is also crucial in identifying where risk is high and can be mitigated. We know with certainty that we need to stop cleaning, start ventilating and filtering, embrace the science of airborne transmission, and shift our focus to prevention strategies that work to reduce the spread of aerosols. Better masking in Greater Essex County District School Boards is a vital component of this strategy. Thank you very much.
Thank you, Ms. MacArthur. Do we have any questions of clarification for Ms. MacArthur? Trustee Halberstadt, go ahead.
Thank you, Madam Chair. Yes, Ms. MacArthur. I was interested in your comments with regard to the effectiveness or not of not, well, it is Virex, I guess, and airborne moves are much better than cleaning touch surfaces with Virex are ineffective. Sorry, I was kind of stumbled over that, but would that be, can you clarify for that for me about
Sorry,
clean
Trustee
touching
Halberstadt, is this
surfaces?
on the masking?
Yeah.
Yes, as explained, there's a preponderance of evidence now that shows us that SARS-CoV-2, the virus that causes COVID-19, is transmitted. The most dominant mode of transmission is in the air and not through droplets or on surfaces. So with the knowledge that that is the dominant mode of transmission, with multiple scientific papers and peer-reviewed publications showing that evidence, and very little evidence to show any spread by surfaces or droplets, the focus must be on preventing transmission using mitigation efforts that stop the spread of the aerosolized or airborne particles. So Virex or surface cleaning is really not the right strategy given the evidence of how this virus is transmitted. Does that answer the question? I mean, I tried to have you visualize by describing it like being, in a room with a smoker, and we have to think about it very much the same way. That if we are in a space where there is not protection from from what's inside that space for you breathing in or breathing out, then others in the space will be exposed to it. When we exhale, when we breathe out, if a person is infected with the virus, they are breathing out those aerosols, and others in that space will breathe it in. And as described by Dr. Brosseau and Mr. Hedges, surgical masks, if you can even feel around your own masks right now, if you look over the top of your noses, there's gaps. If you look at the sides, in front of your ears, at the back of your cheeks, there's gaps. So if you were positive and in a classroom and breathing out in a classroom, let's say if children under 12, you are exhaling virus aerosols, and the potential for spread is great with a mask that is not fit well. As I said, my children, I send them to school in child-size N95 respirator masks each day. They know to press down on the nose piece. They know that they pull them back, and they get quite good fit on them. They've never been fit tested, but they are sized for children. I myself, when I have to go out, also wear an N95 mask. They're readily available. They're extremely comfortable. In fact, my children commented when we made that shift, when they became available, that they were much more comfortable, easier to breathe than cloth masks that we were wearing last year.
Thank you, Ms. MacArthur. Any other questions from trustees for Ms. MacArthur this evening? Seeing and hearing none, Ms. MacArthur, will you provide those written remarks to Madame Leboeuf?
I will indeed. Thanks so much.
Thank you. That will help with our minutes, and we appreciate you sharing with us this evening and joining us. I'll give you a few seconds just to jump off the phone here.
Thanks for the time.
So we do have one last speaker this evening. Mario Spagnuolo will be speaking on L2 and L3. Let's give him a second to jump on here.
Hello? Unknown participant is now joining.
Mr. Spagnuolo, is that you?
Yep, that's me.
Wonderful. So I will give you 5 minutes. It will start after you introduce yourself. Although we are familiar with you, I will give you a minute to introduce yourself just for edification for the rest of everybody listening. And then your 5 minutes will start. And then there'll be an opportunity for trustees to ask you questions of clarification. But I'll start the 5 minutes whenever you are, when you're ready.
Yep, you can start it now, Trustee Higginson. Thank you. Good evening, trustees. On November 12th, Dr. Teresa Tam confirmed what many experts have been declaring for months: evidence on aerosol spread of COVID-19, that expelled virus particles can spread over distances and linger in fine aerosols for periods of time, much like secondhand smoke. The Chief Public Health Officer of Canada goes on to say that wearing a well-fitted, well-constructed mask when in public spaces helps reduce virus inhalation and spread between people, particularly if ventilation is not optimal. In general, while non-medical masks can help prevent virus spread, medical masks and respirators provide better protection and are essential during the COVID-19 outbreak. However, there are important differences between both of them. Masks are loose-fitting, while respirators are tight-fitting around the nose and mouth. Respirators create a seal to prevent air leakage. Although medical masks may offer some protection to the wearer, the primary purpose is to prevent cross-transmission of germs. Even without formal fit testing, respirators have been shown to be more effective than the current Level 2 medical masks used by staff in our schools. I'd like to thank Trustee Leclerc for putting forward the two motions tonight. It would be preferable if our provincial government would have taken the lead on protecting our educators and our students. But what has become obvious during this pandemic is that the public education system has not been a priority for the Premier and the Minister of Education. They have failed to invest at a most critical time. They have failed to provide enhanced safety precautions in our schools. Instead, our education system has been the victim of recent funding cuts. As a result, our community is relying on school board trustees to be the true leaders for students and staff and their families. While I have the opportunity, I'd like to point out that our own board safety plan must be updated. Page 5 of the plan states that COVID is transmitted from person to person through respiratory droplets left on surfaces in close contact. This contradicts what Health Canada is now advising and what health and safety experts have been cautioning for over a year. To properly control the spread of COVID-19, it requires a shift. Think smoke, not rain. An umbrella may protect you from the rain, but not from the wind or the smoke. We need to start using the proper tools that are readily available. The focus on cleaning desks and wiping objects is distracting from where our attention should be: ventilation and clean air, social distancing, and enhanced PPE. By filtering the air breathed in by the wearer, respirators such as N95 and KN95 will help not only in protecting the wearer, but also the spread of the disease. It must be noted that eye protection and shields do not replace the need of enhanced PPE and masks. They serve two different purposes and work together. You may hear that the employer must follow the guidance provided by the ministry's return to school plan. Although this is accurate, nothing stops the employer from permitting superior protections for workers' health and safety. In fact, ETFO, along with other teacher affiliates, have been told in provincial working groups that the Ministry of Labour would only take action if PPE was below standard, not superior. Some have used the following analogy: mask diligence is like defensive driving. The worse others are around you, the more diligent you need to be. The number of active cases of COVID-19 associated with Ontario's public schools has surpassed 1,000 for the first time in weeks. One recent statistic showed that when categorized, over 35% of cases in Ontario are from elementary schools. The next highest level is 10.8% from other workplaces. This should be of no surprise, as children under 12 cannot be vaccinated. With the increase of cases in the cold weather arriving, it is imperative to take proactive measures. Trustee Leclerc's motions have already been approved by other school boards, including the Ottawa Carleton and Toronto Catholic. In Thames Valley, this has been an adopted policy without any issue since September from local health units and the Ministry of Labour. It would be unreasonable under the current context for our board to forbid its employees to opt for enhanced use of PPE that has superior standards than what is being provided by the ministry. While on the topic of proactive measures, the board must continue to deploy more HEPA air filters and begin to examine ventilation in real time with CO2 monitors. There is more work to be done in order to protect our students and our educators. The pandemic is not over, and our collective efforts are needed now. Thank you for the opportunity to address the board this evening. I'd be happy to answer any clarifying questions.
Thank you, Mr. Spagnuolo. Right on time. Appreciate that. Any other questions for Mr. Spagnuolo of clarification on his speaker this evening? Go ahead, Trustee Cook.
Just a quick question. You mentioned Ottawa Carleton passed the motion that Trustee Leclerc has in front of us. I don't think it's the same motion. In fact, the wording in it is much different, and it makes the education staff responsible for their own masks and for the fit testing. My question to you is, did our chief medical officer actually come out and say that education staff and everybody should be wearing specifically N95 masks?
I think the science is clear. You've heard from two other experts this evening that the better your PPE, the more protected you are and the people around you. Trustee Cook, I'm not going to get into a debate with you about this. I debated the primary masking mandate last year, and you were proven to be wrong on that as well. So let's not get into a back and forth.
Mr. Spagnuolo, there needs to be some respect in this room, as it's shown to you.
Well, I think trustees to show that through their own leadership. And
Mr. Spagnuolo.
Yes, this evening.
Mr. Spagnuolo, if we'll stick to the question, I'll allow this to continue. Otherwise, we'll have to be done.
That's fine.
So I'm just going to ask again, did our chief medical officer state that education staff should be wearing N95 masks?
What she stated on November the 12th is that COVID-19 there's evidence that it spreads through aerosol spread. And in the same speech that she gave, she spoke of the importance of enhanced PPE.
Thank you. Any other questions of clarification for Mr. Spagnuolo? Seeing and hear. Trustee Burgess, go ahead.
It is for the speaker, and I hope he can answer, but I will ask if on behalf of his representation for ETFO and being at all the meetings, etc., I believe it's captured in live stream, but is it not true that last year in June 2020, for example, when we were presented with our COVID protocols going forward for school year 2020-2021, we looked at all of our preparation for enhanced ventilation and PPE as COVID being primarily spread by fomites, by contacts and surfaces, and that ventilation was there, but it was not thought to be an airborne virus. And then going further, if I could ask, has ETFO followed this progression, and that all of our discussions of last year with very little, last calendar year, had no discussion of a Delta variant that changed the parameters for filtration of air, So how vigilant has ETFO been on looking at the situation, and can you comment on how it's ever evolving?
So thank you for the question, Trustee Burgess. So we've, with COVID throughout the pandemic, we learn more and more every day, obviously. And so what we have done as a union is continue to advocate for improvements based on what we're learning through the science. And so, yes, ventilation has become more of a priority over the last several months, including recent conversations and feedback to the Health and Safety Department about the theater of desk cleaning, for example, and not focusing more and more on air and ventilation. And the previous speakers tonight spoke to that we need to have a shift from this being, I'll give you the example of what most people can relate to is in the first few months of the pandemic, I think everybody in that room and in my office, we were cleaning our groceries when we brought them home. We were wiping them down. We're not doing that anymore. We're not wearing gloves when we go to the grocery store. What we are doing is we're focusing on what the science is saying, that social distancing, wearing appropriate PPE, and improving air ventilation. So yes, ETFO has been very active both at the local level when we're asked to provide feedback and also at the provincial level at our working groups to improve the learning and working environment of our staff and students. So that's why we're here tonight, again, is because we're trying to make things better and we're trying to follow the science. And the science is very clear. The better the PPE, and Dr. Teresa Tam speaks to this on November the 12th in her speech, the better the PPE, the better the fit, the safer you will be.
Is there a supplemental, Trustee Burgess?
I don't think so. I wanted to hear that it was evolving. We're an education organization, and we're going into now the times when we're going to be more indoors. So I appreciate that ETFO's on top of looking at emerging science as well as analysis. Thank you.
Thank you very much. Mr. Spagnuolo, I did have one question. You mentioned a few boards that had adopted, whether it's the wording of this motion or other similar ones, and one of them was Thames Valley. And you mentioned specifically for them that there had been no, no adverse reactions. You specifically mentioned Ministry of Labour and Public Health. I'm wondering if there has been anything from Ontario Health and Safety Association and any, if you are aware of any negative reactions from that side of this equation as we are we operate under their authority as well.
I have heard no negative repercussions on any worker or employer that has mandated or permitted the use of enhanced PPE. What health and safety experts look at is that the employer doesn't provide inferior PPE. So there's Trillium Lakelands, Ottawa Carleton, Thames Valley, Limestone District, Toronto Catholic. All of these boards have adopted something similar to what is in front of you tonight. And I have heard no negative repercussions from any agency. What I've heard is quite the opposite. Kudos to these boards for taking the lead and, to use Trustee Burgess's words, the evolving science in adopting policy to reflect the evolving science. And as an education institution, that's exactly what we should be doing. And it's unfortunate that you're put in this situation as local trustees. It should be coming from the provincial government. It's unfortunate it's not.
Thank you very much. And you'll provide those written statements to Madame Leboeuf from your presentation this evening?
Madam Chair?
Yep, go ahead. Trustee Olmsted, did you have a question before I wrap up here?
Yes.
Go ahead.
Yes, I do, through you, Madam Chair. Thank you, Mr. Spagnuolo. I just reading the motion passed by Ottawa Carleton, and I know that the onus is placed on the staff wearing the masks to ensure they're fitted properly. Have you had any indications from your members that they would be against having that onus to ensure that their masks are A, approved by Health Canada, and B, that they're fitted properly? Would that be too much to ask of the members, or is that something that you think would be accepted and embraced?
Thanks for the question, Trustee Olmsted. So those members that are comfortable wearing the level 2 masks that are provided by the ministry, and they can continue to do that, we don't have an issue with that. We wish that it would all be enhanced, but we get that the government's not funding the boards to do that. The feedback that I have gotten on Trustee Leclerc's motion has been completely positive. People realize that we're in a situation where it isn't funded, and so they will take the proper steps that they need to do to make themselves feel better. I know we've been focusing, and I'm guilty of this too, a lot on the physical, but there's also the mental health piece. We have many members who go in with a lot of anxiety of COVID-19. And I think as individuals, we can probably relate to this on personal levels with family members and friends. So this would not only improve their physical well-being for certain staff, and they would take the measures necessary to do that, but also their mental health and the peace of mind for some of our members who, quite frankly, go in fear every day that they might be contracting the virus or bringing in the virus as an asymptomatic individual. So, yes, I think that this would be welcome news, and our members, like always, would take the steps necessary to make themselves comfortable and the children around them using their own professional judgment. So I get it's not the best language. We wish that the government would fund and provide enhanced PPE for all, but we realize in the province of Ontario, with the current government, that isn't going to happen. And so this is a compromise to what would be an ideal situation. I hope I answered the question.
You did. If I may, could I ask a supplemental?
Yep, go ahead.
Thank you. I'm sorry. I'm going to apologize again. My voice is very bad this evening. I have a bit of laryngitis, so if it cuts out, I apologize. My other concern is for individuals, because this will be enhanced PPE provided by the individual. What about those individuals who perhaps can't afford N95s to wear every day, but they want that? Obviously, it would be much better if the ministry was providing this level of protection. Is there any plans in place to have additional PPE provided, maybe by ATO or another organization, just in the event that someone cannot afford N95s to wear every day? I mean, I wear them when I leave my house, as do my family. We live in a very high-risk household, but I know the cost of them. They're readily available, but they are much more expensive. So I just wonder if there's any contingency plan or discussion to assist those individuals who might not be able to afford an N95 every day.
Well, that's something that I can bring back and discuss. I think what we need to do is focus on the second motion as well, because it should be the government's responsibility to take care of that, and we would work with the trustees to continue our lobbying efforts on that front. And like all other issues that I brought forward to the board in the past, we would work with the school board trustees to advocate on behalf of public education.
Thank you very much.
Thanks so much.
Thanks, and thank you, Trustee. Thank you, Trustee Olmsted, and thank you, Mr. Spagnuolo. We'll give you a few minutes to jump off the phone here, and then we'll continue on with our agenda. Thanks for joining us this evening and sharing your viewpoints with us. We appreciate it.
Have a good.
Give it a few seconds here. Thank you, trustees. We will move on to L1, and as I mentioned at the beginning of the meeting here tonight, that the statements were not available at the time of agenda prep, so I want to be able to read the recommendation for the record and for the edification of anyone listening who doesn't have it in front of them. The recommendation at L1 is that it be recommended for approval by the Board of Trustees that the attached audited financial statements of the Greater Essex County District School Board for the year ended August 31st, 2021 be approved. Do I have a mover and a seconder for that? Moved by Trustee Cook.
Could I second that then?
Absolutely, yep. Seconded by Trustee Hatfield. Do you have any discussion on this? Go ahead, Trustee Hatfield.
Thank you. So I just wanted to say, I won't take much time, but the audit report and the whole process of the audit went very well this year. It was a good report. There were no major findings of concern. And on behalf of the Audit Committee and the trustees, I want to thank all our staff that were involved in doing the audit. It's a lot of work, and at the end of the day, everything went really, really well. So thank you to all the staff that were involved in this as well. And if you have any questions, Superintendent Armstrong would be happy to answer them. Thank you.
It's always the common refrain around here. Any other questions? Thank you, Trustee Hatfield, for that. Any questions from trustees for administration? I want to pass along my thank you as well. I know a ton of work goes into this that we don't see, and this is a very comprehensive report. It's also very important to us as trustees to see that the decision making that we do in this room is supported operationally and is supported fiscally responsibly, as it is one of our strategic directions. And Superintendent Armstrong, your team, and the rest of the senior team are instrumental in that. So thank you to yourself and your staff, and to the director for putting us in the kind of position here where we can support those initiatives that we need so desperately. So thank you for that. I will call the question, seeing no other questions or comments. All in support. Anyone on the phone?
Yep, support.
Thank you. Thank you. Thank you very much. I appreciate that, and that passes. Moving on to L2, we have a notice of motion from Trustee Leclerc. Education staff be permitted to obtain their own Health Canada approved respirators, be permitted to wear these in the workplace, provided staff follow the application and removal guidelines stipulated by the Canadian Centre for Occupational Health and Safety, CCOHS, and staff will continue to be supplied with ministry-approved PPE. Do I have a mover and a seconder?
I'd like to move that, Madam Chair, but with a slight amendment.
Absolutely, Trustee Leclerc, and I see it's been supported by Trustee Sipkar. On the motion, Trustee Leclerc?
Yeah,
I would
so
like
if
to put the amendment.
yes, I would like to add in, after the brackets where it says CCOHS, we would add the words including providing their supervisor with written confirmation of a fit test.
Okay, so there is an amendment being put on the floor by the mover that after where it says in parentheses CCOHS, the words would be included here, the following, including providing their supervisor with written confirmation of a fit test. Is that correct?
Yes.
Do I have a seconder for that amendment?
Burgess.
Trustee Burgess has seconded that amendment. Any discussion on the amendment? Trustee Sipkar.
Thank you, through you, Madam Chair. Can I just ask the mover the rationale for that additional wording?
Yeah, I want. Well, at some point, I want to speak to the whole motion, but yeah. So I think part of the Ontario regulations require N95s to be fit tested. So we've heard earlier tonight that the N95 works well even if it's not fit tested, but I believe there's a requirement that N95s must be fit tested in Ontario.
Thank you. Any other discussion on the amendment? Give our phone folks a few seconds here. Seeing and hearing none, I'll call the question on the amendment. All in favor of the amendment?
Support.
Thank you.
Burgess.
Support Olmsted.
Support, and that passes. So the on the main motion, Trustee Leclerc.
Thank you. So just a few words that have been coming through the news most recently. Ontario's 7-day rolling average continues to rise. Yesterday, Austria announced that anyone who's not immunized will have to remain in their home. We've heard the word another COVID winter. We've also heard about the acknowledgement that this is now an airborne issue. You've heard the science tonight from a number of speakers, but I've brought this motion to provide support to our staff, a staff that has worked very hard in very difficult frontline environment and has worked in a very professional manner, providing education to our students despite their own concerns, anxieties, and trepidation. I've heard the requests from teachers and support staff that want to continue to provide their students with the best education. However, they wish to have the opportunity to access enhanced PPE at their own expense. Other boards across the province have provided their staff with this opportunity. I do not believe this will result in any issues for our board, but it will send a clear message to our staff that we support them. And that's why I'm bringing this motion this evening.
Thank you. Any other discussion or questions on the amended motion? Go ahead, Trustee Halberstadt.
Yeah, I guess I'd like to know what the cost of this would be. It would be nothing, is the way I think, Mr. Trustee.
The intent of this motion is if
Sean Mayhew is now exiting.
Madam Speaker, if I can speak, Madam Chair.
Yes, indeed. Go ahead.
Sorry, I'm finding being on the phone a little awkward. So the intent of this is we are aware that there is no funding for this at this time. And some teachers, like all teachers provide, or frontline staff provide, they buy stuff for their students all the time. This is a situation where some have expressed that they're prepared to step up and provide their own enhanced PPE. Ideally, the province would step up and take care of this, but in the meantime, if we can support our staff who are prepared to do this, I think we should.
Just supplementary, if this is passed, would that mean that, I guess that would mean that if I'm coming in here with another mask, I wouldn't be told to go back with a surgical mask, because that seems to be uniform. It's a rule in this corporation. Is that not correct?
Is that a question to administration?
I'd like to have administration comment on the motion, what it means according to them.
Thank you, through you, Madam Chair. I'll certainly start. And I do have Juliana Hinchliff, Manager of Facility Services, and Tim Lozon, who's the board's Health and Safety Officer, who are available as well. The way I read this motion, it talks specifically about education staff. So in reference, for example, to yourself, because you use that as an example, we would still require you to wear the medical grade masks because you're not education staff, the way I would interpret this motion to read, as well as any visitors or contractors that are coming into the facility, administrative staff that are working in the board office. And then we have other staff, for example, employment assessment counselors, our JEEP counselors, media center. They would not, I don't believe they'd meet the qualification of an education staff. So we'd have to be cautious because the way this is written seems to imply that there would be different PPE levels that would be available for some staff and not for others. Certainly, we've heard reference to science quite a bit tonight, and I do thank the speakers. I respect everyone's opinion on this. I just want to clarify from the board's perspective, in terms of science, the COVID safety plan that the board's developed has been based on the direction and the advice from the Ministry of Education, Public Health Ontario, the Sick Kids Hospital, the Windsor-Essex County Health Unit, and the Ministry of Labour. So all of our COVID protocols have been in place and developed with reference to all of those bodies, including consultation with our 84 occupational joint health and safety committees and our union partners as well. We've heard reference as well to the importance of having tight-fitting masks or something that seals to an individual's face. PPE is the most visible source that we identify in dealing with COVID, but it is probably the last measure that we should be implementing in terms of addressing COVID. We have a multiple layered health and safety approach at the board. PPE is simply just one measure. We're sitting 6 feet apart today, so that's physical distancing. That is another measure. We do self-screening, and we ask all employees, contractors, and visitors to self-screen. We have immunization protocols at this board to try and address those measures as well, including testing for those that don't wish to share their vaccination status through rapid antigen tests. So that work is also going on. We have hand hygiene, hand sanitization. We've reconfigured, recompartmentalized. We've tried to put engineering controls in place. We've heard about ventilation measures at the board as well. In 2020-21, we spent $12.7 million on ventilation. For this school year, we have another $6.9 million of ventilation also that's going to be put in place. And what that means is that every school that has a passive or partial mechanical ventilation is going to have full mechanical ventilation in their spaces. The only exceptions are going to be schools that are scheduled for closure because we are building new schools. In all those spaces that don't have full mechanical ventilation, so they have partial ventilation, HEPA units, air purifier units are in place. We have 824 HEPA units that have been put in place, including every junior and senior kindergarten classroom, regardless of whether the school has full ventilation. On top of that, all of our steps and gains classrooms, also we have put HEPA units in there again, regardless of the type of ventilation that's in the schools. So certainly we've heard the importance of ventilation. There's been references that this may be an airborne virus, and I believe that the board has done a lot of extensive work to support that and to address those concerns from a ventilation perspective. The board, as the employer, prescribes the PPE that needs to be worn by the staff. We do that through the references that I've mentioned in terms of the guidance that we refer to. We do ask that staff wear medical grade masks. We wear level 2 medical masks that are ASTM rated. That's the American Society for Testing and Materials, level 2. The ministry requires level 1. So the masks that we wear today are greater than what is being recommended through the public health resources and sources that I've mentioned to you. We also provide PPE for eye protection, whether it's face shields, safety glasses, or goggles. We provide vinyl and nitrile gloves. We also provide disposable gowns. We do have staff that are issued N95 respirators, and that's because they perform aerosol-generated medical procedures for certain students in the board. And just to try and explain that a little bit, that fit testing takes up to 2 hours to do. It is not a quick process that gets done. And the staff do need to be trained on how to wear and to don and doff those N95 respirators. And again, we make them available to them because they are in close contact with bodily fluids. The only other thing that I want to mention, then I'll turn it over to Julie and Tim if I've missed anything, is that the board is legislatively required to follow the Occupational Health and Safety Act. And that act outlines the requirements with respect to personal protective equipment, and it assigns duties and responsibilities to employers, supervisors, which in this case would be our principals at schools, and the workers. And the employer is responsible to provide the appropriate equipment and PPE to their workers and make sure it's maintained in good condition. We do that based on the health and safety guidance and the various forms that I mentioned at the beginning of my comments. We also provide appropriate training to staff. All staff have had COVID-19 training. Our supervisors are required to make sure that their workers are wearing the PPE that's prescribed by the board. The workers are required to wear the PPE that's been provided to them, and making sure that they have taken the appropriate training. We've consulted with the Ministry of Labor. The challenge with this would be PPE that's not being provided by the board or prescribed by the board. This is a staff member being able to bring in their own respirator. We've heard references to KN95s. Those are not medically rated, so we have to be cautious there. I've heard references to N95s, which don't need to be fit tested. Yet we'll talk about masks and that they're not tight. So I'm just a little bit concerned about a few of the comments that I've heard this evening. But we did consult with the Ministry of Labor here locally, and I know we've heard that other boards have adopted elements of this. Our local Ministry of Labor, we reviewed this notice of motion with them. They've confirmed that if they are required to come into a school because of a complaint or for any other reason, and if they observe that respirators are being used by staff in schools, or like I said, they've received a complaint, they're going to enforce the Occupational Health and Safety Act. And they will do that by looking at what is required in the board's COVID-19 safety plan. They will look at the reopening guidance from the Ministry of Education as well. And when they enforce the Occupational Health and Safety Act, it's not an order that is issued just to the employer, which in this case would be the board. It would also potentially involve the supervisor, which is the principal, and it will involve the worker as well. And the Ministry of Labor has indicated that they will request all the training records of the worker being fit tested and the training that was done for that worker, and in terms of whether they know how to properly handle and care and the maintenance, and do they know the limitations of the respirator. They will also ask whether the staff are aware of the frequency in which the respirators need to be changed out due to soilage. And the enforcement, again, it's not just to the board, it would also include the principal and the worker themselves, could be an order. It also could involve tickets and charges as well for non-compliance. So that's a risk that the board has. And we also need to be cautious too that now we are asking site supervisors or principals to follow up with staff that do bring that PPE in, potentially bring that PPE into school, to track the testing requirements and the fit testing, and it creates an exposure. I think it's important to acknowledge that. And I would certainly ask Tim or Julie if they have anything further to comment on, if that's okay. I would certainly welcome that.
Yeah, that's fine for me.
Thank you very much. Any other questions?
Sorry, Matt.
Sorry, do I have somebody on the phone?
Madam Chair, if I may, Tim Lozon.
Go ahead, Mr. Lozon.
No. All right. Sorry, using the phone has some cumbersome to it, so I apologize. Just to further support what Shelley has shared, that also the messaging from our local Ministry of Labor was also shared at the provincial working group by the Ministry of Labor as well. So it's not just local, that's what the Ministry of Labor also shared with the provincial working group. Just wanted to add that. Thank you.
Thank you for that. Trustee Cook, did you have a comment or question?
I do. Thank you very much. Through you, Madam Chair. I have a question for Superintendent Armstrong. I heard you say that the documents could be requested in terms of fit testing. So if this goes through tonight and some staff starts wearing N95, their documents are needed ASAP, correct, to keep on file. I know you said too that the principal is like the supervisor. Is that who monitors all of this? And I'm just curious, even now with our medical masks, principals still have to monitor and make sure that everybody's wearing them. So now the principals would be expected to get all the documents also and keep them on file just in case.
Thank you, through you, Madam Chair. All of our occupational joint health and safety committees are site-based. So we have 84 sites. So it would be the responsibility of the site supervisor. For example, at this board, I'm the principal of the building, so I would be responsible for monitoring that. For an individual school, it would be the individual principal. So it's easier to monitor when everyone is wearing the same PPE because it's being provided by the employer. But in this instance, all of that, including the training records and the fit testing, would all need to be monitored and tracked by the principal because it will be requested by the Ministry of Labor, because we have been told that.
Any supplemental, Trustee Cook? Trustee Sipcar, go ahead.
Thank you, through you, Madam Chair. I have a question for the mover. One, I guess I need the amendment repeated, but also I noticed that it does say Health Canada approved respirators when we've been having a conversation that's also involved different levels of enhanced PPE, particularly masking. As I am not well versed in this area, does the term respirators cover that as an umbrella term, or is that a specific type of PPE? And if so, is this motion narrowly only empowering staff to really only have one type of enhanced PPE? I don't know if Trustee Leclerc, you can answer that. What was your intent there?
Trustee Leclerc, are you muted, perhaps?
Yeah, so it took me a second to get off the mute. So the intent was that there's some concern that N95s or N99 have to be fit tested under the Ontario regulations. And so that's why I added in that the words after CCOHS including providing their supervisors with written confirmation of a fit test. So that shows that they're in compliance with the requirements under the labor legislation.
So with respect
I think the most
go ahead.
The most readily available and easily obtainable mask that most would use is an N95.
So then just as a supplemental, perhaps this is to administration, the word respirators, does that include different types of masks such as N95 and N99s? Just for my own knowledge to know if that's what this is a part of, or is it a specific type, like a respirator is just one specific type?
I'll probably, I'm going to defer this to Tim Lozon, but I believe the term respirator is too generic of a term. There are, like I said, KN95s that are not medically rated at all. There are N95s, I've heard reference to N99, so I think perhaps Mr. Lozon can comment.
Yes, respirators is a general term, and it is generic, and there are well over 100 different types, makes, models, and suppliers. For example, we keep throwing around N95. Originally, it was 3M, N95, 3M being the manufacturer. Make and model was N95s. A lot of companies over the last 4 or 5 years have been doing knockoffs of N95s. Caution on K95s. There are a number of K95s that are not approved by Health Canada for COVID-19. There's a number of them that have been recalled as well. There's also North. It's another manufacturer of N95s. You also have N99s now. It's another new one as well. You also have respirators that can come in a half-face mask with cartridges. We want to make sure we don't go down that road because there's no cartridges for COVID. You also want to make sure you don't go down the road of respirators that are full face masks or powered air purifying respirators, which also takes you down the road of gas masks, for example, and cartridges. So using the word respirator is really open to interpretation. I hope that helps.
Actually, Madam Chair, I just have a comment if that's okay, but I can wait for a second turn if that's fine.
Yeah, just wait for I'll put you on the list for a second one there. Trustee Cheen, go ahead.
Hi, thank you, Madam Chair. And I have a question and also have a comment on this motion. My question is that what's the current requirement of our school board regarding the mask? Because I know that we provide the mask to the students, but as far as I know, those students, they bring their own mask to school. Some are cloths, some are repetitively used more than 1 week, and nobody really, question them. So what's the current, requirement of those protection plan? Yeah.
Through you, it's different for students and staff. This motion is referring to staff, but my understanding is for students that they can bring their own masks. So this is a motion about staff, and this is the kind of mask that is required at this time.
Sentimental, yeah. And to my understanding, this motion is just give the right to the education staff, for the teachers to have their right to have a upper level protection. I don't see why we have such barrier to forbid them to do that. Because they have their right to protect them, and they are responsible for their own safety. And as far as I know, even though some certain kind of N95 are not, really good for the COVID-19, but there are a lot of kinds, they are much better than common, masks. So in this motion, it didn't request the further investment, and they just allow them to use their own, respirators. So I don't see why we give them, hurdles like a fit test or something like that to prevent them to use that. Am I clear? Thank you.
Is that a question for administration or just a comment on the motion itself?
It's more comment. Thank you.
Thank you for that. I appreciate that. Any other first questions from trustees? Student trustee Hawkins.
Thank you. So in the motion, it doesn't state anything that the masks that education staff will be providing themselves with will be superior to the level 2 mask. So does this motion allow for staff to be wearing masks that are less protective than the ones that are provided to them? That's to the mover of the motion.
So the intent is, so right now, through you, Madam Chair, a respirator is superior to a mask.
Do you have a supplemental? Does that answer your question?
No, we just spoke about respirators as in that covers any PPE masking, right? So now we're differentiating between respirators and masks. So now can we go over that one more time about what's the difference between a respirator and a mask?
Perhaps Mr. Lozon, can you go over that one more time for us? The question on the floor is that the motion mentions respirators, and then we just had a discussion about respirators, and the question was whether the masks that the respirators would be a potentially inferior protection based on your expression of respirators. Can you go through respirators again for us, the types and what's covered by the term respirators?
Absolutely, Madam Chair. So let's start with the mask. So what's currently prescribed is a surgical medical grade mask, level 1, ASTM spec, so American Standards testing. So that's what our staff have, and right now we actually have level 2, which is above the required, being level 1. With respect to other people, so everybody that's at the administration building right now, you're wearing what's called a mask. So it's that the little blue and white square. Also, other people have masks that look like that, but they're not surgical, so they're cloth masks. So those are masks. You would typically remember those prior to COVID pandemic. You'd see them maybe at the dentist or the doctor's office, and certainly used in surgery. They are not a respirator. All a mask does is helps contain your droplets, so you don't infect somebody else. And there is a certain level of protection from droplets coming into your breathing area as well. But a respirator is absolutely a better grade. A respirator, depending on what the nature of the contaminant is you're trying to filter out or protect yourself from. Respirators, for example, if you're working with asbestos, would be a half-face respirator with HEPA filters. If you're working with chemicals in an industry, you'd probably have a respirator that's a half-face respirator with charcoal cartridges because you're filtering out a chemical medium. So that's when you get into over 100 different makes and models of respirators from different manufacturers and suppliers. A very common one is 3M N95s. That's what we use for our aerosolized generating medical procedures at two of our sites, as Superintendent Armstrong had previously mentioned. You have North N95s, you have K N95s, you have N99s, and then you get into full face masks or full face respirators, such as powered air purifying respirators with cartridges. I also want to note as well, with respect to N95s that have an exhaust or exhalation valve are not legal with respect to COVID-19. They're not accepted by Health Canada. So there's lots of things there. I think education piece would be required for our staff to select a respirator. Food for thought. I hope that helps.
We're getting nods from Student Trustee Hawkins. So yes, thank you very much for that clarification on that. Any other first questions from trustees before I go on to second questions?
Just have a supplemental to that one. Is that okay?
No, unfortunately. No, sorry. We just have a lot to get through tonight. Sorry. I do have a question as a first question for to administration. So I'm trying to get around I'm trying to get through the gap here that we have between what I want to do to be able to protect staff as much as possible and what we are responsible for, both as protection for our board, because as trustees, that's something that we need to be aware of, and as protection for staff as well. And so I'm wondering, we've had a few things mentioned tonight: Ministry of Labor, OHSA, WETU, Public Health Ontario. We've had a few things mentioned tonight that kind of oversee these kinds of adherences to PPE within our schools under the COVID context and before and after COVID. What are our risks as a board if this were to pass tonight? And I have some questions about respirators as broad as those are, which may play into this a little bit. What are our risks if this was to be adopted tonight to levels of where we're at in the board? What are our risks? What risks are our staff assuming? What risks are our administrators assuming, and what risks are the board assuming? And I'm trying to get a sense of how I can mitigate some of those risks in order to be able to empower staff to do this.
Oh, that's a big question. So I'll start the answer, and I'm going to ask Julie and Tim to chime in. Some of the risks, I suppose, would include the board would not have any, the word's not going to come out right, no matter what word I try to use. Control, that's not really the right word. The PPE that's going to be brought in potentially by an education worker, the board would not have any knowledge of the type of PPE, the respirator that it is, the kind that it is, this motion does not, we would have no documented evidence of that it even meets Health Canada's requirements. The only documentation that we're asking for is that they've been fit tested. So that's issue number one. We wouldn't even know if this even meets Health Canada requirements. We wouldn't know if it's approved for use for COVID, or that the fit testing or the training has properly occurred. So that's a couple of issues right there. The work by a principal to have to track all of this on top of all the other requirements that they are trying to implement and to keep monitoring in a school in a COVID setting is significant. Now we are asking them to take on more work. We would not be in compliance with the Occupational Health and Safety Act, period, because it's not PPE that's been issued by the school board. We're allowing someone to come in to our building and to wear something that has not been issued by the board. So if you end up with an illness, then we could end up with WSIB claims, occupational illnesses, things of that nature that would have a financial cost to the board, including with lost time, and absenteeism is potentially there. And we have no guarantee that what someone is wearing would not equally result in transmission to somebody else. We would result potentially in having fines to the board, to the principals, and to the workers. It would not be just one person. It would be all of those groups. And certainly we would not be in compliance with the Ministry of Education. I don't know, Tim and Julie, if you'd wish to add on to that, but those are certainly some of the risks the way I would see that.
Is there anything from either Tim or Juliana?
Yes, Madam Chair, if I may.
Go ahead, Tim.
And Shelley's absolutely correct, and great overview. And so it's the noncompliance of OSHA, the education guidelines, also the WECHU we would not be in compliance with, their toolkit, also their enforcement of our COVID-19 safety protocols. I do want to add with that, we've had 32 audits by the health unit so far this school year. And each and every time, it's going through our safety protocols and procedures, including our masking requirements. So it's certainly it's on their radar screen, and we've had 7 Ministry of Labor visits already this year, and it's on their radar screen. And we've been in compliance through all of those so far this year. So this puts us at risk for non-compliance. And the other tool is we would not have and don't have a tool for any oversight, as Shelley said, of this whole process, which adds another layer, of liability for us.
Thank you, Mr.
I hope that helps.
Thank you, Mr. Lozon. That I appreciate that, and thank you to Superintendent Armstrong that clarifies some things for me. This is a tough one. I won't lie that it's this puts us in a strange position. I agree with the speaker we had earlier tonight that this should be the ministry dictating this. I feel torn on this one still, minutes from a vote. So I will, I see Trustee Olmsted has a question, then we'll, I see Trustee Sipkar I know has a comment as well. And then we'll be looking to...
Let's please.
Trustee Burgess, I'll put you after Trustee Olmsted, and then we'll be looking to call the question on this. But Trustee Burgess and then, or Trustee Olmsted and then Trustee Burgess. Go ahead, Trustee Olmsted.
Thank you, through you, Madam Chair. There's been a lot of talk this evening about our reopening plan and being in non-compliance with several ministries, which I'm not going to name because there are many, and other standards. My question is, how have other boards who have passed motions similar to this, how have they made it work? Because I don't see any logic here. If other school boards have passed similar motions, How are they in compliance with other Ministry of Labor's? How are they in compliance with the Ministry of Education? Have the reopening plans been altered to include enhanced PPE? There's been an incredible shift in how COVID is understood over the past year. We know it is not passed through respiratory droplets. It is airborne. Dr. Teresa Tam, who is our Chief Public Health Officer, sent out a series of tweets the other day, and I'll quote the one. There are many types of masks, but those that fit with a snug seal on your face and are made with layers of materials that can filter fine virus particles are best for preventing and reducing infectious respiratory particles that you may inhale. And she is referring to COVID in a series of 5 different texts or tweets. I'm not understanding how we cannot make this work as the Greater Essex County District School Board. Can our reopening plan be altered to include staff being able to wear health-approved respirators, Health Canada-approved respirators? Can we ensure that those staff members who are all educated adults receive the proper training and fit tests? That onus would be on them to provide the paperwork. If they're willing to make that expensive, step forward and purchase N95s for themselves to wear every day, then they would have that onus on them to provide the proper paperwork. Therefore, they would be in compliance with the Ministry of Labor and all other standards. And I don't understand. I understand that there's more work. This is going to put added responsibility on principals and other administrators, and I know everyone has had their max. But with this shift in thinking and the science about COVID, we know it is an airborne virus, and we should be taking every step as individuals to protect ourselves. So why can't we make this work? Why can't we take the steps to ensure that we are in compliance with all of the different ministries? If it takes altering the plan, then let's do that work to ensure that our staff is protected if they so choose to wear enhanced PPE such as respirators. I can't understand how one board is making it work, but others can't. And I think this is work that is very important and that it needs to be done.
Superintendent Armstrong?
Oh, goodness. So I'll start again, and I'll call on Julie and Tim to assist. That's a great question in terms of how other boards are making it work. It could be that they have not had a Ministry of Labor complaint called in. It could be something, specific just to that. Part of my job as a superintendent of business is to identify the risks. I'm not saying that respirators are bad. We've never said that in this meeting at all. We do appreciate the health and safety of not just our students, but our staff. We want everybody to be safe and healthy when they come to work or they come to school. But my job is to tell you what the risks are, and we brought this motion to the local Ministry of Labor, and it was shared at the provincial working table. And the way it has been expressed to us by the Ministry of Labor is that because staff are bringing in their own PPE, it's not prescribed, it's not provided by the board, that is a contravention of the Occupational Health and Safety Act. Maybe at another board, you haven't had a complaint called in. Maybe there hasn't been an audit that has been done. I can't comment on what other boards are doing. I can only comment on what specifically we have been provided by our local Ministry of Labor. But it does come back down to the Occupational Health and Safety Act and what the word prescribed means in terms of PPE, and that means the employer's providing it. The best advocacy is to have the Ministry of Education change what they are suggesting that boards need to provide to their workers, and it's all workers, not just educational workers. I work in a building today. There's 130 adults that are in this building, so it's all workers, and certainly that advocacy would be welcomed. Tim and Julie, if you want to add to that, I would appreciate it. Thank you.
Thank you, Shelley. Madam Chair, if I may.
Go ahead, Mr. Lozon.
As noted by Shelley, we certainly can't speak for other school boards, but I can share my working relationship with my WASBO counterparts for health and safety. Clint is the health and safety officer at the Ottawa Carleton Board. That motion just passed October 26th, and they're still trying to implement that with respect to an attestation in all the requirements. So that's not even fully implemented yet or up and running. So that remains to be seen, any additional challenges or ministry of labor issues or what they're going to have there. It's my understanding that the Toronto Public Board, this motion failed, and Thames Valley is still going through this, as well as a few other different school boards. So this motion, this whole process, really hasn't been up and running a long time for us to get a true measurement of Ministry of Labor's orders issued elsewhere, if any. I hope that helps.
Thank you, Mr. Lozon. Trustee Olmsted, did you have a supplementary?
Oh, I had so many. I understand this is a really complex issue, and we could be putting ourselves out on a limb here as a board. I'm not talking about trustee, but as a board. But it is my belief with every fiber of my body that this has to occur. If everything was perfect in society and within our schools, there wouldn't be any COVID within our school buildings, within anywhere. And I know that an N95 or a respirator won't prevent that. But as we've heard from many, many people this evening, including Dr. Teresa Tam, over and over again over the last 3 days, layers of protection are needed. And while we were wearing masks to prevent the spread of COVID from ourselves to others, the onus is now on us. We have to also protect ourselves, and that goes for, our teachers in the classroom, our support staff in the classroom who are working with unvaccinated children, who are working with vaccinated children. We know that this virus can be passed on well vaccinated still. And I think that we need to take that risk. We need to do the work. We need to find out how other boards have made it work. And if they're in the process, then let us be in the process too, because I think that every single step has to be taken to protect every member in a school, including the children, because our students are only as safe as our staff, and our staff is only as safe as our students. This is a global pandemic, and I think we have to take every single precaution that we can. And I understand that we might not be in compliance, but I think we need to figure out how we can be and take those steps. And if the onus is placed on the educators to provide the documentation, I think that they will provide that documentation. I think it's that important. It's their health, and it's the health of their families. So I thank you for the explanation, but to me, this is of utmost importance this evening, and I think the shift in science is supporting us going out on a limb and taking this chance. I think we need to be proactive and not sit back. Thank you.
Thank you, Trustee Olmsted. Trustee Burgess, go ahead.
Thank you, Madam Chair. Thank you for all the discussion to my colleagues and to admin and the presenters who came forward under the speakers list, as well as everybody who's researched and put time into this. Thank you to the mover. And I have a question to the mover, I suppose, but I'm making some great assumptions with this motion. I'm making an assumption that based on what we know about our education staff, we have education staff who will not be vaccinated, who cannot be vaccinated. We have education staff who would like to go unmasked, education staff who are happy with the existing PPE, and we have education staff who want enhanced PPE in the form of a Health Canada approved respirator. I'm going to assume that in supporting this motion, that the education staff who want enhanced respiratory PPE are going to obtain at their own cost, which is in excess, it's out of their own pocket, their own Health Canada approved respirator, thinking not that it's inferior, but that it's actually better for them and those around them and their families, and that they will provide some sort of proof that it is a Health Canada approved respirator, even though I heard all about there's no oversight, there's no way, it's going to be, bureaucratically more difficult, etc. I'm going to ask and implore, if this passes, that our education staff look at this, who want to have an enhanced PPE by owning a Health Canada approved respirator, that they provide proof that it is a Health Canada approved respirator, even though it's not in the motion. I'm assuming that they will want to do that because they want to wear it. And as far as the amendment that has already been passed, including written confirmation of a fit test, I'm assuming that we want to do this as best we can, knowing that this is on the edge of progressive legislation. I want to go on record saying I support L3. We haven't even got it on the floor. But the fact is, this is about money. This isn't only about what's best. It's about money. If we were progressive enough and followed the science, even if we want to do belts and suspenders, it's not an attractive look, but some people like belts and suspenders. It gives them that surety, that mental health, less anxiety, that they think, because of what they've done, they're going above and beyond. And it may be outside of fashion. It may be outside of what's presently on the books. But, science evolves, standards evolve. Some people feel unsafe at work. They want access out of their own pocket to get a Health Canada approved respirator. I think they should be able to do that. I support this motion. I support it with the written confirmation of a fit test. I think that helps the wearer of the respirator, as well as alleviating the anxiety that they know that they're wearing it correctly. And I believe that Health Canada has a good approval for these things. So I support this. But my question to the mover is, are you I'm sorry that it only says education staff, number one, but I'm not going to go for an amendment. Is it your assumption, too, that you have faith in those folks who have made it very clear that they want enhanced PPE, that they're not going to come in with a respirator that is somehow inferior or not Health Canada approved?
Through you, Madam Chair.
Have in the education staff.
Go ahead, Trustee Leclerc.
Trustee Burgess, thanks for that. I think when this was written, Health Canada approved respirator was put in there for the specific purposes of it being something superior to the mask. So the one thing I would point out is just because, so in the motion it says Health Canada approved respirator. So I don't think there's anything that prohibits in this motion a administrator from asking the staff member to provide that proof that it is a Health Canada approved respirator. And I do have faith in the education staff. And you're absolutely right. There's some that don't want to wear masks. There's some that are not vaccinated. But we've heard from people that are in our system that want to have the opportunity to, out of pocket, take the steps to wear superior PPE, meaning Canada-approved respirator. And I guess part of the reason this is focused on education staff is because education staff a lot of our education staff is exposed to individuals that aren't eligible for any vaccine at the moment, or they are dealing with students that are vaccinated, but are in a situation where maybe they're more tactile students, students that are in games programs or other more supportive programs, and they have closer contact than they have closer contact with students than they would have in an office setting, let's say. So, yes, I do have faith in our staff. I'm supportive of our staff, and that's why I brought this. And I appreciate your support.
Thank you very much. I'm going to move pretty quickly forward. I think we've done a good job of questions, so I'm going to move pretty quickly forward this last little bit here. I do have Trustee Sipcar, Trustee Cook, and then Trustee Leclerc is asked to be able to finish it off, and then I think I'm going to call the question after that. So Trustee Sipcar, go ahead.
Thank you. The concern that I had with this motion was around the use of the term respirators, and that if that was indicating that it was a superior form of PPE. From my understanding and from this discussion, that is the correct understanding. I also had a concern regarding what the board's obligation is to provide a safe workplace. And I believe that through the discussion and through the necessary documentation, I believe that because that the burden is on the employee, that this is something that it is at their own volition, and therefore we are participating in enhancing their safety. We're not requiring less than what the ministry is. We're just saying if they want more. And I think that at the end of the day, I have supported additional measures in the past, and I believe that our staff are at the front lines, and if this is an additional piece of physical equipment that enhances their safety and that is proven by Health Canada and also documented, then I think that we should support them in that. I wish that this was a directive from the Ministry of Education. I wish that this was clear, but in light of that, I do feel that our community has made it clear to us that there are some staff that would like this additional measure of protection, and I think that we can respond by supporting them in this way. So I will be supporting the motion tonight.
Thank you, Trustee Sipcar. Trustee Cook.
Thank you, Madam Chair. I just have a question, because the problem that I'm having too is the same as what Trustee Sipcar mentioned about respirators. I mean, there's so many different kinds out there. And most can't be fit tested. I think there's only 2 that can be, and that's a 95 and I forget the name of the other one right now. So my question to you, Superintendent Armstrong, through you, Madam Chair, is you had mentioned that some of the staff already wear N95s. So what if the staff that want enhanced PPE wear the same type of the same N95s that staff already wear? Would that make this process any easier? They get their enhanced PPE and then we're following the guidelines because we're already doing that in the schools.
Well, we procure them locally through a local supplier. I would probably defer to Tim Lozon because he would know the implications relative to the Occupational Health and Safety Act.
Thank you, Madam Chair, if I may.
You may. Go ahead, Mr. Lozon.
That's not a bad idea, my friends. So our 3M is the make and model of our N95. So that is written into our safety plan. It is prescribed. Of course, it's for aerosolized generating procedures, not for regular common use. So that's something that would have to be tweaked. But we also, our respirator management program, which is something you also have to have in place, which covers your donning, doffing, maintenance, changeouts. We have that in place for our staff that we have allocated 3M N95s to. And in the fit testing, obviously, we use a third-party consultant to do the fit testing. So that's the information that I have on that one, if that helps.
Supplementally?
Thank you very much. So my question to the mover is, this way of doing it, saying the N95, the 3M N95, say that 5 times. If we put that into the motion, I think that would work much better because it's already in the schools. We're not going to have to worry about, not following the guidelines because we already have staff wearing those. And our staff that want enhanced will be able to have the enhanced, and we're doing it the right way. I totally agree with staff wanting enhanced protection. I understand that. I just think that if we do it this way, so I'm asking the mover if he would be willing to do an amendment and put the 3M N95 mask instead of respirators.
Trustee Leclerc?
Yeah, I'm totally fine with that. So after Health Canada approved, we could add in the words 3M N95 respirator.
So the amendment that you're proposing is that the first sentence would read, education staff be permitted to obtain their own Health Canada approved respirators, comma, 3M N95 respirators, and be permitted to wear these in the workplace, yada yada?
Close. So if we went to where it says, okay, education staff be permitted to obtain their own Health Canada approved 3M-N95 respirator, be permitted to wear these in the workplace provided staff follow the application and removal guidelines stipulated by the Canadian Centre for Occupational Health and Safety, including providing their supervisors with written confirmation of a fit test.
In the last line, staff will be continued to be supplied with ministry-approved PPE. So that amendment has been, motions on the floor for the amendment. Seconder on that amendment.
Support.
Trustee Burgess has supported it. Do we have any very brief, guys?
It was Trustee Hatfield, but...
Thank you, Trustee Hatfield. Thanks for that clarification. Any very brief discussion on that amendment, guys?
I have a quick question.
Go ahead, Trustee Hatfield.
I thought I heard Mr. Lozon say that there were two pieces of enhanced PPE equipment, the 3M N95, and I thought there was something else. And my point is, I think we should include whatever those enhanced approved items are.
Mr. Lozon?
Another one in addition to.
Mr. Lozon, is there another one in addition to the 3M N95 respirator?
There are many types and brands, but the only one that we have is the 3M N95.
Oh, okay. So there's just a one piece over and above.
Correct.
Okay, thank you. I misunderstood before.
Thank you for that
clarification. I'm good with it. Thanks.
Thank you. Any other discussion on this amendment, very briefly? Seeing and hearing none, I will call the question. I'm going to call the question on the amendment. All in support of the amendment, adding 3M.
Can I have a recorded vote, please, Madam Chair?
A recorded vote on the amendment?
No, on the main motion, ma'am.
Thank you. We're just on the amendment right now. So I'm going to call a vote on the amendment, adding 3M N95 in between the words approved and respirators in the motion. All in support.
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 And that passes. Trustee Leclerc will finish up our discussion on this, and then we will call the question on the amended motion. Go ahead, Trustee Leclerc.
And a recorded vote, please, ma'am.
Indeed, I think Trustee Leclerc was already on that, but Trustee Leclerc, go ahead.
Yeah, I think I said my piece. I hope that everybody's prepared now with what we've added in, clarifying it. Kind of wish that last piece of information would have come forward a little quicker. That would have made this a lot easier, but we're here now. So I hope everybody can support this.
I appreciate that brevity. We will go to a recorded vote. I will call everybody by name. Trustee Cook.
Support.
Can you turn on your mic?
Support.
Trustee Halberstadt.
Support.
Trustee Sipkar.
Support.
Student Trustee McCowie.
Support.
Student Trustee Hawkins.
Support.
Trustee Sartori.
Support.
Trustee Ching.
Support.
Trustee Burgess.
Support. Support.
Trustee Olmsted.
Support.
Trustee Hatfield.
Support.
Trustee Leclerc.
Support.
And I am also in support, and that passes. Thank you for that very fulsome discussion, both to trustees and to administration and to Ms. Hinchliffe and Mr. Lozon on the phone. Thank you. Moving on to L3, that the GEC-DSB write a letter to the Ministry of Education requesting approval of masking better than level 2, and the ministry fund this enhanced PPE for all staff and students. Trustee Leclerc, would you like to move it?
I would.
Do I have a seconder? Trustee Sipcar. Any discussion on this? Very brief. We've just had a very affirming discussion for a long time.
If I could.
Indeed. Go ahead,
Sure.
Trustee Leclerc.
Given the fulsome comments or discussion we just had, which we wouldn't need to have if the ministry was actually, or the provincial government was actually funding this level, we wouldn't have had to take all that time to pass this previous motion. So that's why I'm requesting this letter.
Thank you for that. Any other discussion? Trustee Chin?
Thank you, Madam Chair. As I have mentioned, that including for all staff and students, I don't think is doable. Because even now, the students, they use their own mask and they repeatedly use it, and including cloth mask. So it's not really, doable to fund to all students the PPE above the level 2. That's my concern.
Thank you. I don't want to speak for the mover here, and Trustee Leclerc, you're able to speak. I think when we're writing a letter, I am prepared to ask for the farm. I'm prepared to ask for what we need, and I think asking for all students and staff is the intent of the letter. I will let Trustee Leclerc to confirm that you would like it to include for all staff and students, that is the intent of this, is to request the enhanced protection funded by the ministry, enhanced both for our staff and enhanced for our students. Is that correct?
Indeed.
Thank you. Any other discussion on this?
Burgess?
Go ahead, Trustee Burgess.
Quickly, we asked for better ventilation and better MERV filtration on our mechanical HVAC systems, etc., and we got some support from federal funds and from provincial funds. If you don't ask, you don't get it. So I support this, and I think it's not only in order, it's overdue. And I hope that the response we get back is not just thank you, note and file, that they actually look at the evolving science and support enhanced PPE of all kinds, but certainly in this motion, better than level 2 for all staff and students. Thank you.
Thank you for that. I'm in support of this. I think it's also in support of not only our own staff and students, but of staff and students and communities across this province. So other member boards have written things just like this, and our support lended to Trustee Burgess's point, along with those, is helpful to all Ontarians, and investments in this kind of safety are incumbent upon us as politicians to request. So, Trustee Leclerc, would you like to wrap it up with anything before I call the vote?
No, thank you.
I will call the question. All in support of L3?
Support, Burgess.
Thank you. Anyone opposed? Trustee Chin, thank you. And that passes. Moving on to L4, we have a notice of motion from Trustee Sipcar to further demonstrate the board's commitment to environmental stewardship that the GEC-DSB declare a climate emergency. In doing so, the board acknowledges the impact of greenhouse gases on the climate and commits to adopting a climate action lens to its existing structure, operations, and behavior of its staff, students, and school communities. The board will be required to commit to an action plan, including priority action items, implementation measures, and cost implications toward the reduction of emissions from its operations. Trustee Sipcar, would you like to move that? Do I have a seconder? Trustee Cook, any comments? Trustee Sipcar on the motion?
Sure, through you, Madam Chair. To my fellow colleagues, this is directly from the report that was brought to the Ops and Finance Committee meeting 2 weeks ago out of the Single-Use Plastics Ban Committee. I would invite administration to speak to it, but I think that as it is their words and it was their recommendation, I don't know how much more is further needed to be said. I think it's a really important motion, and I'm really proud of our staff for bringing this forward. It shows our just progressive and forward thinking that is occurring already in our board, and I thank them for their work, not only on that committee, but throughout the entire system. And I would invite them to speak to it. As I think Superintendent Armstrong herself may want to speak to it, or even some of the staff.
Thank you, through Madam Chair, and thank you, Trustee Sipcar. I have with us, as I mentioned, Julianne Hinchliffe, but also Kathleen Quenville, who is the board's Energy and Environmental Officer, on the phone. I'll just speak to it briefly, and then certainly they can add their comments to this as well, and certainly they're available to answer questions. The board completes an energy conservation and demand plan. We do that every 5 years. It is a legislative requirement under the Green Energy Act. So the last plan that we brought forward for the 5-year period of 2019 to 2023, we brought to the board for their approval on June the 18th of 2019. So the thinking is that the energy conservation demand plan would be the starting point for developing the plan that would be part of the climate emergency declaration. And we would augment that plan to coincide with this declaration, and we would have it completed in time for the 2023-2027 energy demand conservation and demand plan. Certainly between now and then, we would be happy to provide updates on the implementation of the current plan and the energy reduction goals and the progress that we have as part of that plan. Part of this action plan as well would focus on measuring our carbon footprint. So we would be looking at what is being produced in our buildings, transportation, food waste. And we'd also look at our carbon handprint, which is, as Ms. Quenville explained the last time, it's what we're doing to actually reduce the footprint. The work would include an educational component to it. We would also incorporate the work of the Single-Use Plastics Reduction Committee. We would also consider anti-idling measures, and we would collaborate with the Active Transportation Committee and the Eco Schools programs. So the way that our initial thinking is with respect to this is we would build on the demand plan that I've just mentioned. We would have to make sure that we fully understand what the carbon footprint is of the board, and that we would develop that plan in June of 2023 as an enhancement of the energy conservation demand plan. And with that, I would certainly welcome Ms. Hinchliffe and Ms. Quenville's comments as well.
Excuse me, this is Juliana Hinchliffe, through you, Madam Chair. I'd just like to add just a couple of points to what Shelley said. I think this is a great move forward for the board. I think it provides a climate action plan that is all-encompassing and covers as many actions that the board takes. It would cover procurement. It would cover program. It would envelop, or it would be an umbrella plan that would even bring eco schools and environmental stewardship under its umbrella. And it allows all staff to participate in environmental stewardship and looking at all their actions through that climate action lens. So it's a great initiative, and I think in the end, it'll really be impactful for everyone. Thank you.
Hello, this is Kathy Kenville. I'd like to say thank you to Superintendent Armstrong, Trustee Sipcar for putting forth this motion. I'm really excited to be part of this, and I'm glad that you're considering climate action for the school board. Thank you.
Thank you very much, and thank you for your work on this and for joining us this evening. Do I have any questions from trustees? I did have a question. And I heard both Superintendent Armstrong and Ms. Hinchliffe mention both active transportation and then programming. And I'm looking at things kind of broadly in this, and I note that you've kind of looked at some of the things that will go into this plan. And I think it's incumbent upon us to also look at how we do things like our programming decisions that could take into account enhancing active transportation. So when we're busing children out of their neighborhood to other schools, what is the impact of that on our carbon footprint? When we're building schools and how far they are from current neighborhoods, are we looking at those sorts of things in this plan as well?
If I may, through you, Madam Chair, I think the Active Transportation Committee is all-encompassing at this point in time. It's a very large network and involves multiple boards, and the work they're doing far exceeds even our own board. And so I think they need to continue their initiative because it impacts globally across all the school boards in this area. Well, I think we need to support their work. We need to acknowledge their work in our climate action plan for our school board and make sure that whatever initiatives that they're implementing through our schools is supported by our climate action plan.
Thank you, Ms.
Hinchliffe
is now exiting.
That was it. She's out. Mic drop. Superintendent Armstrong, do you have anything to add to that?
Thank you. I think just it's a very broad ranging action plan that we would be looking at. So certainly it would involve, it's not one individual that's going to be responsible for developing this plan and solely implementing it. So I think, just touching on the work of the Active Transportation Committee and all the individuals across the board will be looking to collaborate to ensure that we are addressing, as many aspects as we can as part of this plan.
Thanks for that. And I noted that you have a kind of a timeline for when it's going to kind of be developed, and it's huge and all-encompassing, so I can appreciate that. And yet you're still able to provide us and willing to provide us updates as you kind of move along, which I very much appreciate, and I'm looking forward to those. And I'm wondering whether it's through Director Kelly or yourself, Superintendent Armstrong, or anyone, whether these, when we see these maybe coming into our operational plans or our strategic plans, some of these things being incorporated into those as part of our, as Ms. Hinchliffe said, our strategic priorities of ethical stewardship.
Through you, Madam Chair, I think that a lot of that is already incorporated within this upcoming year's operational plan, and I'm sure that will continue to be extended as this plan rolls out. So it's a good question, but I think we're already on their way.
Wonderful. I'm thrilled to hear that. Do I have any other questions from trustees?
Burgess.
Trustee Burgess, go ahead.
Motions on the floor, so not only questions are in order, just commentary and debate and discussion. So I just wanted to add, as an information piece, when we have had in the past proposals for consolidations of schools or new builds, etc., there have been successful motions in the past where the motion on the floor to approve a build or a consolidation or whatever to include active transportation as a priority in the site selection, that has happened in the past, and it has been successful in the past. So regardless of all the other discussion as a standalone thing, if something comes forward and we feel strongly enough about, not putting a school in the middle of nowhere where everybody has to be bused, et cetera, for example, to try to find that site that really does support active transportation, if it's possible, we can do that. So I just wanted to add that to the discussion. I also want to say that this was like a dream come true motion. I just want to say that it aligns so beautifully with our strategic priorities and what we're trying to do. I also want to say, reiterate, on the forward thinking of this, this is something that our student trustees, our student population should embrace because it's their ethos that we're looking at. It's for them. It's for the world that they inherit. And there's just so much good about this. So thank you for everybody who had a hand in it. I support it wholeheartedly. Thank you.
Thank you, Trustee Burgess. That was very positive. I really appreciate that. Any other questions or comments from trustees before I call the question on L4? Trustee Sipcar, do you want to close it off, or are you good? You're good. All right. So I will call the question. All in support?
Support.
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 Thank you very much, and that passes unanimously. Much appreciated. Trustees, I have blown entirely past trustee question period. Are we okay to keep going through the agenda? It will be on there shortly. Do I have any opposition to going through the rest of the agenda and getting to it when we do? Trains are running.
Kathy Kenville
There we
is
go.
now exiting.
Report of the Director of Education. Director Kelly, go ahead.
Thank you very much, Madam Chair. Over the past 2 years, we've spent a great deal of time ruminating on all the things that we've not been able to do in our school communities because of the COVID pandemic. But this evening, I'm pleased to report to you that though we are still unable to do much in person, beyond the confines of school and the limits of current restrictions, I can show you that there are, in fact, great things happening every day in the Greater Essex County District School Board schools. Many schools found ways to raise the legacy of a great Canadian hero and raise money for the Canadian Cancer Society with Terry Fox events this September. Our school eco teams are back in the business of recycling and protecting the environment in and outside their schools. At Queen Victoria Public School, they've been able to take advantage of nice weather to get out and enjoy nature in their neighborhood. We continue to participate in important annual observances, such as flying the Every Child Matters flags at our schools. And Picture Day is back this year. Respecting physical distancing and safety procedures, we can once again see the smiling faces of students adorning fridges everywhere. Our wonderful community partners from area fire departments were able to pay visits to schools this year and give our students some first-hand instruction during Fire Safety Week. Outdoor learning experienced a revival during the pandemic as a welcome break from the necessary constraints indoors, and I'm happy that in many places we continue to make use of outdoor classrooms. The Great Big Crunch, once again, was resounding throughout schools this year as students enjoyed apples and information about healthy diets. High schools were able to celebrate some academic accomplishments together with the Outdoor Awards of Excellence ceremonies such as this one at Riverside Secondary School. Our school communities never stopped being contributors to their communities, but we've been able to increase our participation in things like Socktober at Hugh Beaton Public School. Halloween and harvest festivals were more interactive this fall. At Kingsville Public School, they enjoyed a donation of pumpkins from Lee and Maria's, while at Coronation, the grounds were not just decorations, but were part of the math classes. And earlier this month, along with Trustees Higginson and Halberstadt and members of our senior team, we were at Kennedy Collegiate to receive Built Heritage Awards from the City of Windsor for our recent work to preserve Kennedy and John Campbell Public School. Of course, Remembrance Day was commemorated in excellent fashion this year across the Greater Essex County District School Board. Along with being part of the classroom work, we found new ways to observe the day with socially distant and virtual ceremonies. And this month, we proudly released our updated African Canadian Roads to Freedom curriculum documents to our teachers during their PD session. Updates included new research on Black Lives Matter movement, school segregation in Ontario, slavery in Canada, and more. And we are grateful to the expertise of our community partners and our own Chantal Moring Brown for their expertise and insights that they shared. And we began our staff census last Friday to gain improved knowledge about who our staff are and how they identify as individuals. response has been good, but we're hoping for 100% participation. So the short survey will be open until November 30th. I also want to acknowledge that this is the end of a Board of Trustees year in many ways, and I just want to thank Chair Higginson and Vice Chair Kathy Cook for their leadership over the past year, and to all trustees for the roles that they've taken and the support they provided to me and to the senior team. Thank you.
Thank you very much, Director Kelly. Do we have any questions from trustees for the director? I'll let our phone friends have a minute. Thank you very much, and thank you for both that report. It's very nice to be able to see things that are going on in the schools when we don't get to see them very often. Director Kelly and I, when we were at the Kennedy Awards, we both remarked about how nice it was to be at a school and see the energy there and feel the energy there. So I'm sure students probably are feeling that as well. So it was wonderful to be able to see that. Thank you. All right, moving forward to M2, report of the OFSPA Director or Delegate. Trustee Burgess, do you have anything in here for us in here this evening?
I do, Madam Chair. It'll be hopefully brief. Last time I gave a written report, and I'm always hoping that they make the minutes. But in my oral report today, I just want to state that November 3rd, day after our last meeting, we had an OPSPA Western regional meeting, and all the regions were meeting about primarily Project Compass, which is a governance and overview thing. But I will say it was every item was a timed item. Trustee Cheen joined me in that virtual meeting. There was a lot covered, including a board update on behalf of Greater Essex. Then on November 10th, I attended a program development work team meeting, and we went over quite a few policies of a provincial nature, and we had lots of input and really appreciated the guest speakers. We have an upcoming Board of Directors meeting at the end of this month for OPSPA. It will be the last Board of Directors meeting that I will be there as Greater Essex's director, as our organizational meeting will come forward, and we organize ourselves and we select our directors and delegates. So I will give that report, if I could, on behalf of the board at the first meeting of the newly organized board, whether I return or not as the director. But at that Board of Directors meeting on the 27th, Greater Essex does have and has given notice that there will be a motion there to have OPSPA endorse a change to the oath of allegiance that trustees take upon taking their office. You will know that the Education Act does say something like, you have to swear to this, but you may take an oath of allegiance. And, of course, it's to Her Majesty and successors, etc. But there is a motion coming forward, and it's from Greater Essex, to align the oath of allegiance, OPSPA's recommendation for an oath of allegiance, to be more aligned with the oath of citizenship for Canada. Now, some of you may know that the call to action number 94, resulting from the Truth and Reconciliation Commission, was to come up with a better oath of citizenship. And indeed, that happened on the first Indigenous Peoples Day in June. And so for July 1st, this first Canada Day, by then we had a brand new oath of citizenship. If you become a Canadian citizen. And it included reference to the fact that basically we're all treaty people, and that not only do we have allegiance, if we can choose to swear or affirm, we don't have to the reigning sovereign, but we do recognize that we are treaty people, and we recognize that. And I think that's essential for school board trustees, and we're bringing that forward. I'll let you know how that motion fares in December. And that ends my oral report.
Thank you, Trustee Burgess, for that. Any questions for Trustee Burgess? I just want to thank you very much for your work. I know it is a heavy job to take on the director, the OSPA director, and I know that you represent us quite effectively. And I want to thank you very much for this organizational year and your work with that on our behalf. So thank you very much, Trustee Burgess.
Sure.
All right, we're moving down to M3. Annual report to the Board of Trustees forwarded to the Ministry of Education for the year ended August 31st, 2021. Do we have anyone looking?
That comes from the audit committee. That would be me, Trustee Hatfield.
Wonderful. Trustee Hatfield, would you like to make a comment?
No, it's really short, and you have it there. There's really nothing to comment on.
All right. Do we have any questions on this from trustees on M3? I'm seeing and hearing none. Trustee Hatfield, would you like to then comment on M4 as well?
Yes, that's something similar, although that report was prepared by Superintendent Armstrong, so I'm sure she would answer any questions if you have them. Sure.
Do we have any questions on the asset retirement obligations report in our package? There's my next timer. Trying to keep myself honest today. We're almost there. Seeing and hearing none, thank you very much. We'll move through those. We're on to Chair's reports. I do have one for in here this evening. It is my last meeting as the chairperson of the GECDSB in this 2021 organizational year. I'm quite proud of the work we've accomplished, relying on expertise in our community and organization to protect the health and safety of our students and staff. The inspirational naming of a proud new high school being built in the community of Amherstburg, embarking on an equity action plan, passing a budget that's both fiscally sound and supportive of the varied paths to student success, development of our strategic priorities, which acknowledge the road we've taken to get here and the realities of what building tomorrow together really looks like. I want to acknowledge that leading in this role is not a solo job, that it is collective, it is collaborative, and it's intersectional. And I did objectively know that COVID would play an outsized role in the governance of our organization this year. And what I was persistently reminded of is two things. First, sure, COVID, but not only COVID. And second, never underestimate the power of people. When you take a look at something like our board's strategic plan, it's huge. What's hidden underneath every goal and every measurable and every potential is the people that put their heart and their head into every piece of success for our students. It's hours of work and a mental and emotional load carried around daily, hourly, and constantly. We get but snippets views in this room of the momentous tasks that go into the halls and classrooms of our schools, our facilities, buildings, our administrative offices every day. And while it may not be advantageous for our senior administrators and our director to give themselves the kudos and recognition of their work, it is my honor to do so. Thank you. Thank you. We all know that adjusting to change in our lives, well anticipated now, is quite disruptive. And imagine being responsible for that across all of our sites, all of our students, all of our staff. It's a lot, and I appreciate you very much. And when we do that from the Director's Council level, we do so with the knowledge that our educators, administrators, and support staff execute all of it as leaders of our schools. It's not just a push-button job. There are human experiences in each of these decisions. There are human experiences in realizing them for our students. And if you'll permit me a bit of a personal story, my youngest daughter is isolating right now from a high-risk exposure. I got the call, calm, reassuring, informative as ever, from the school. This is my family's fourth isolation, so we're familiar. It is still anxiety-inducing. The privilege in my flexible work environment allowed me to go quickly pick my daughter up. And the front of the school is crowded with anxious caregivers just like me, making it work. I see leadership every single place I look. staff making sure every single guardian or parent is personally acknowledged within seconds of arriving, reassured of next steps, where their support will be coming from in this tough week ahead. The principals there coordinating safe goodbyes to these young learners heading home for the week and reassuring them she's so happy to see them back next Monday. My daughter's teacher sent her home with a positive message, a bag of materials that her classmates were working on, and a plan for what her week would look like and how they would accomplish it all together, while he still has a classroom of students to mentor and teach and lead. All along that timeline, people's lives were interrupted. Each piece of interruption was met with a kindness, a support, and all of that from people whose own experiences are stressed by this new wrinkle. And it gave me pause to witness what was but one of several disruptions to the school environment that our staff adjust to every single day. And so I thank you, to each of you, for the seen and unseen parts of yourself that you bring to your work every day. This chairship in this time has been an eye-opening experience and a very humbling one. Not only do I do nothing alone, there is no progress in going it alone. We go together, even when it's hard. We've heard from our stakeholders that they expect more from us. And these shifts in our thinking are filled with productive failure. They're filled with growth and connections where we encourage them to grow. We're committed to the work. I am committed to the work. The challenge is an opportunity to commit to something we can all trust and be proud of. That's a truly inspiring foundation to build tomorrow together on, emphasis on together. I thank you all for your trust, for your partnership, for what you've taught me, for the shifting of the lens we and I look through. And I look forward to the future with renewed passion, with a foundation built of these hard steps, and with the knowledge that surrounded by these people we're so privileged to work with, we have transformative times ahead. So thank you all very much. We'll move forward to trustee question period. Any trustee questions this evening? Trustee Halberstadt.
Yeah, we heard tonight there's mounting evidence that COVID-19 virus is transmitted primarily by airborne means, and clean touching surfaces that we use is ineffective. I'm wondering if administration is realizing this mounting evidence. It seems to be accepted now pretty well wherever you go. And is administration taking stock of this and talking about perhaps changing their practices that we've had for many years, because it's not effective unless you can prove otherwise that it is effective. So I guess that's my question, and I have some other correspondence that I'm going to leave with trustees with regard to this issue.
So is that a question through to administration? And who would like to take that? Superintendent Armstrong, go ahead.
Sorry, thank you. Through you, Madam Chair, I will start, but I believe Tim Lozon and Julianne Hinchliffe would certainly like to comment. As I've indicated, the board follows a multiple layered health and safety approach. Cleaning and disinfecting high-touch surfaces is certainly one of several layers that we put into place. I'm not aware of anything that is suggesting that cleaning and disinfecting is not an appropriate measure, not just against COVID-19, but we're also into cold and flu season. Certainly, I think most people would agree that we need to continue to keep cleaning surfaces that are being touched multiple times by individuals. It's one measure of multiple that the board is putting in place to try and keep students and staff safe. It is also a recommendation from the Windsor-Essex County Health Unit and through the Ministry of Education, and so that is why that is reflected in the board safety plan, and it is part of the responsibilities of the custodial staff.
Just supplementary, I would urge trustees and administration to look at the Maclean's Magazine article that was published, I think, October the 29th. It's very informative and very thorough, and it addresses this issue. and it's actually it's on our inbox. You can find it by just going in there and reading it. It's very fascinating. In fact, the conclusion seems to be that we've been doing it all wrong. So you can accept that or not, but it's a very persuasive argument. Again, October 29th issue of Maclean's Magazine on this issue.
Thank you, Trustee Halberstadt. Any other questions from trustees this evening? Student Trustee McCowie, go ahead.
Burgess on the list.
Thank you, Trustee Burgess. I'll put you on the list. Go ahead, Student Trustee McCowie.
Thank you. So it's my understanding that students in the Greater Essex County District School Board virtual school are not permitted to physically enter their home schools. So at this time, grade 12 students are in the process of having their graduation photos taken, which occurs in person at these home schools. Students in the virtual school have been instructed to go to the University of Windsor to get their photos taken. However, this does require students to be fully vaccinated. In an effort to better support graduating students in the virtual school, as well as respect their decisions in privacy, what can be done to better accommodate students who have chosen to either not get vaccinated or who are unable to go to the University of Windsor to have this done? This is a concern many students in the virtual school have shared, and we're hoping an accommodation may be made allowing virtual school students to enter their homeschool buildings.
Through you, Madam Chair, I believe Mr. Corbick will answer the question.
Thank you for the question, and through you, Madam Chair. We are aware of this concern, and as Student Trustee McCowie indicated, LifeTouch at the university is currently allowing students to book seatings to have their grad photos done, but the university does require full vaccination in order to enter the campus. I have been in contact with LifeTouch about this issue. And we are looking at a solution, and one of the things that we're considering at this point, well, two questions. Are students able to have photos done elsewhere and then have LifeTouch include them, both for the school to put in the yearbook and on the grad composite? And also, are we able to organize perhaps a Saturday afternoon at a central location, perhaps one of our schools, in order to organize that? One of the challenges LifeTouch has at this point is that they too are struggling with staffing and are behind in their brick and mortar school photos. So the understanding I have from LifeTouch is it would be semester 2 before that could be organized, but we do have that in the works, and I'm actively working on a solution to that.
Do you have a supplemental? That's good. Thank you. Appreciate that. So I have Trustee Sipcar and then Trustee Burgess. Go ahead, Trustee Sipcar.
Thank you, through you, Madam Chair. This is to administration. I remember we discussed this when the motion, a few meetings ago, when the motion came forward around face shields, and then it came up for me again tonight, and then it was also brought forward by a parent. What is the process for a student to receive a mask exemption? Is that something that can just be found on our board's website, or is that an admin procedure as well, in addition to what's publicly available?
Superintendent Elwender?
Thank you for the question. Through you, Madam Chair. We have our mask, for lack of a better word, guideline that's part of our safety plan. So we follow that, and it has all the instructions in there as to what is required. A doctor's note is required, and they typically come through me. I look at them because we want to make sure. Unfortunately, we've had some that have even been somebody's forged them for a doctor. Sometimes they don't give a medical diagnosis from it, and so I just have to look at them and make sure that they're good. And oftentimes they'll even call the doctors if they have given them.
And as a supplemental, I only bring it forward because I noticed that it's not in our safety plan online. That's on a publicly available piece of information that it is approved by our administration. And so I'm wondering, and in addition to that, the timeline around that. And so I'm just wondering, do we have an admin procedure that accompanies it? I think what I've heard from parents is that the process isn't clear, that it needed to be approved at the administration level. I understand the reasons why, and I think that it's good that it is coming through someone in senior admin, but is there a way to communicate that around the timelines and expectations as well?
Yeah, that's not a problem.
Okay, thank you.
Thank you for that. I have Trustee Burgess and then Trustee Olmsted. Go ahead, Trustee Burgess.
Thank you, Madam Chair. Through you to administration, it's a question I brought up, and I've actually brought up in a notice of motion for elementary schools, and I'm going to continue to ask about it because I continue to get call after call after call about parents being upset that their kids don't have an adequate place, a decent place, a comfortable place to eat during their either nutrition break or their lunch. So it's either a break or a lunch, and the logistics of it. The most current questions I've had come from area high schools, where it's been told to me, because of the nature of the building and physical distancing, etc., most kids are encouraged or told not to eat in what is an open cafeteria area or gathering area, but to get outside and eat. Now, I like to picnic and I like to eat outside al fresco as much as anybody, but the questions I've had from parents are that these kids are scrambling to try to find some place to sit. They're sitting on a curb. They're sitting on something that's cold. It's a cold day. It's a slightly drizzly day. They're sitting at the picnic bench at the local beer store. They're sitting anywhere they can find in order to gobble some food down, and they need to do that very quickly. That there's often really logistically 10 minutes, and that's it. And I want to know what's in place for students to eat calmly and well with adequate time indoors, knowing that we're going into winter and whether there's inclement weather or not. How are our kids going to be assigned adequate time to eat and not be forced outdoors?
Through you, Madam Chair, I believe we have discussed this question before, but perhaps some updates from Superintendent Hillman and Superintendent Korvac with respect to that, because I know there has been discussion with principals to ensure that there is adequate time.
Yeah, the scenario plays out differently in elementary and secondary. I'll certainly allow Superintendent Korvac to describe or address the concerns you've brought forward right now.
So in the context of secondary schools, one of the challenges is that we do have reduced capacity in our cafeterias as a result of physical distancing requirements. So the solution that most high schools have come up with is that students are given the opportunity for nutrition breaks during class time. So they can eat during class time. They are certainly welcome to eat in the cafeteria, although there is limited space for students to be able to sit and remove masks to eat. They are welcome to be in the buildings during lunch if they are not eating, if they are masked. However, the solution in most high schools, given the limitations on cafeteria space, is that by and large, their time to eat, if they are eating in the building, is during class time. But of course, high school students are free to leave the building at lunch, and many of them choose to do that.
Supplemental.
Go ahead, Trustee Burgess.
Put a fine point on it. So we talked about elementary, and we understand the flexibility. It's going to look somewhere else. My question for today is not elementary. It's about high school. So you're right, and I've heard all of that. But the reality of it is, the reality of the execution of it, is there are kids who are just screaming to try to get somewhere so they can sit and eat properly and then try to get back. I witnessed it, I've seen it, and I've had parents call me from both Essex High School and Kingsville High School, so my two area high schools, lamenting the fact that it's unacceptable for them. It's unacceptable. So I understand the motivation, I understand that it's difficult, but what are we going to do in the middle of a blizzard? You know, on the snow day or whatever, where schools, buses are still running, kids are still there, they've got, masks on, they're trying to distance. They're not going to go out. We're not doing winter camping. So what are we going to do to make it work?
So in most high schools, students are given the opportunity to eat their lunches if they bring them during class time, which would negate the need to use the cafeteria, during class time, which would negate the need to use the cafeteria at lunchtime. Certainly on days where there's inclement weather and students aren't able to leave the building, like elementary, principals are flexible, considering other ways to supervise to allow kids to eat indoors. Again, most schools have provided opportunities for students to eat during class time, given the limitations in terms of available space in the cafeterias.
I have to ask a specific question then through you, Madam Chair, please. We don't have 6-foot distancing. You need to remove your mask to eat. You're doing it during class time. So does that mean there's a room full of possibly vaccinated, possibly not vaccinated, possibly asymptomatic, possibly not, everybody at the same time with maybe a meter distance between them, removing their masks and eating simultaneously in a classroom?
Thank you for the question. Through you, Madam Chair. No, it wouldn't be simultaneously. That's where the checkerboard pattern comes into place, and teachers will stagger so that no unmasked students are always 6 feet from another unmasked student when they're eating, and then they allow the other students who are masked at the time to eat at that time to be able to maintain that distance in the classroom.
Thank you.
To put a fine point again on it, because this is what I've heard, if they're doing it in the checkerboard fashion, like elementary, how many minutes do they get to eat in class time?
Thank you for the question. Through you, Madam Chair. Well, given that there's a much longer class period in secondary schools, we do have 2 150-minute classes a day. It provides a lot more flexibility to ensure that students have the necessary time to eat. So the time challenges are different in high school, given that the scheduled class periods are much longer.
Thank you. Trustee Burgess, if you have follow-up questions for that, I invite you to send them to Superintendent
Thank
Korbach.
you very much.
Thank you. Trustee Olmsted, go ahead with your question.
Thank you, through you, Madam Chair. I have received a few calls and emails from students in the virtual school. A lot of the calls have echoed what Student Trustee Form had previously asked about photographs, students not being allowed in their home schools for grad photos, and alternatively not for photos at all, so they don't have any kind of student cards or any kind of student ID, which is very disappointing for some virtual students. I'm wondering if there's anything that can be done to solve that issue. And my second is a lot of complaints from specialist high skills majors students who are trying to complete their certification in grade 12. And several requirements that they did last year were online and this year are being offered in person. But again, they are not allowed inside of their home schools, so that they cannot complete those certifications. So does this mean that they will not be able to get their special high skills majors distinction when they graduate? Or are we going to be waiving requirements for those students because there doesn't seem to be any kind of accommodations made? They're being offered at their schools, yet they're not allowed into their home schools to complete these requirements. So this is definitely a concern.
Through you, Madam Chair, thank you for the question, Trustee Olmsted. I looked at Superintendent Canty because he has that in his portfolio.
Yes, thank you for the question. We are able this year to offer our SHISM training in person for the students that are at their home schools. We are also offering virtual training for students that are at the virtual school, so no students will lose their ability to get their red seal.
Okay, just a supplemental. I had a very specific call. I was actually from a student, and he was supposed to do a CPR requirement. He did the online version last year, and the in-person component is being held this year, and he is unable to attend because it's at his home school. And he is worried that requirement, he thought that he had already obtained it virtually, but apparently it's not being counted. I know that there's requirements and then there's specific certifications. So I'm not sure whether the students are being really informed properly, but there is some concern. for specialist high skills major students. So maybe communication could be a little bit better to those students because there are concerns.
Thank you for the question. Again, please, if there are concerns with specific students, if they would contact their guidance counselor, we'll certainly get them in touch with our SHISM teacher consultant, and we'll make sure that those requirements are completed for them.
Thank you. Thank you for that. Trustee Hatfield, do you have a question?
Yes, thank you. So in September, at the board meeting in September, I first raised a concern that I heard about the 10 minutes being allocated for our students in elementary schools for their lunch breaks or nutrition breaks. And I'm really concerned to know that we still have what I'm hearing unsatisfactory solutions to allow students sufficient time and sufficient locations for their nutrition and meal breaks. So I share the remarks that were made by Trustee Burgess, and I know that there's still emails and phone calls coming from parents about the elementary students as well. So I guess I'm failing to understand how we have satisfactorily addressed this problem, which will only get worse as the weather starts turning nasty for the winter. So I haven't heard an answer tonight about the elementary panel, where parents are saying it's still a problem. And I'm hoping that through Trustee Burgess, she's going to pursue the situation with secondary, because I'm not feeling comfortable with what I'm hearing tonight. So perhaps someone could confirm that elementary isn't still having the problems as parents are claiming.
Through you, Madam Chair, I do believe we spoke to that earlier, and that there were solutions to that were outlined at a couple board meetings ago, perhaps. But perhaps Superintendent Hillman, could you elaborate on that? I know that you supervise elementary schools.
Sure. Yes. Thank you, and through you, Madam Chair. Yes, we were able to bring the concern that you brought forward to elementary principals a little over a month ago, I'm guessing, and spoke with them about the ways to address that. The challenge, as was presented, is that nutrition breaks are generally set at 40-minute intervals, and that's based on supervision and scheduling. And in a safety plan that requires a checkerboard pattern, meaning the person beside me is eating unmasked and then I'm masked, etc., that students were, in some schools, students were going outside for 20 minutes and trying to alternate that 20 minutes internally. I've supervised 16 schools. I've been in all of those in the last 3 weeks and had them walk me through their lunch procedures. And I don't know of any that haven't added additional time and flexibility to eat within the classroom. And schools have come up with that approach. There have been some parent concerns brought forward. The 3 of them, I believe, I handled or supported. I worked with the school superintendent and the principal, and in each of those circumstances, the parent stated, well, it wasn't their specific school, but this was something that they were hearing. And in some of the other circumstances, the issue was parent concern around the checkerboard pattern, that their students shouldn't have to wear a mask at lunch, and was really not about the specific scenario of they didn't have enough time to eat. And we've made sure that not only are those systems in place at elementary, but that our schools have communicated that if there's any student at any time who needs additional flexibility, that's something that they build in. So I'm confident that any parent who has a concern can contact their school teacher and then their principal, and that is addressed and will be addressed moving forward.
Okay, thank you.
Thank you very much. Do I have any other questions from trustees this evening? Quick check. Thank you very much for that. We'll move through to notices of motion. Any notices of motion for in here this evening? Do I hear any on the phone? I won't sing, sorry. Any announcements for this evening? Any announcements? I don't want to plow through on the phone, but I will adjourn our meeting. Thank you all so very much.